Little slow, Rich.
I'll ask if there's anybody else from the public who'd like to speak on this issue. Come on up, please. And you can use either one of the microphones, feel free. Name for the record, please.
Hello, my name is Julie Buck. I work here. And it is a pleasure to work for Indian River County, I just wanted to say. And I wanted to thank all the commissioners for ensuring that you are taking care of us, the employees. I did just want to make a statement about one thing. The low clinical value list that we were speaking of earlier, where there are recommendations for other over-the-counter medications, that's not going to work for everybody. I know a few employees who have looked over this list, and we realize that that particularly is going to affect us. There were a couple of things on there for like gastrointestinal issues, and there was also migraine medicine. So I just wanted to say that there are a couple of things on there where if we can't take what our doctor has already prescribed to us, we're gonna have more ongoing issues. And that is going to hurt our jobs more, i.e. us having to call out sick because, we can't pay for our medication or we can't even get our medication. Whereas some of us have worked very hard with our doctors for years trying to figure out what combination of medications work for us. And we know that not all medications work the same for everybody. So I just ask that the commission realize this and take that into account too while making a decision as far as going forward with all of this. Because I've only spoken to a few people, but I do know that this will affect us, and we don't want it to affect us. We come here to work for a reason, and we enjoy what we do. We want to be able to perform at our top, 100%. But unfortunately, if some of us can't take our medication, we're not going to be able to perform the way we want to perform. And unfortunately, that's going to come down, and that's going to affect the county as a whole. And none of us want that. So I just wanted to express the importance of that. I understand that we've paid people to do the research for us. But unfortunately, like I said, what works for some people does not work for everybody. And you've discussed that in conversation here today. So I just wanted to make sure that somebody said this specifically, because nobody has come up here and said specifically this yet. So I wanted to make sure that that was represented.
It's a very good point, and someone else came up to me in the break with a very similar thing, that if they went to a different medication and they weren't getting the same results, is there an appeal process of that decision? So Suzanne, could you address that? Because I think that's the kind of some of the concern we've had.
I don't think that the opinion of somebody who's getting paid by the medical company trumps what my doctor has chosen for me, that works for me. So I understand where you're coming from, and I understand the facts and all that, but it does need to be said that it doesn't work for everyone.
Yeah, okay.
Right,
Then
so
if you could
addressing
address-
that, I will turn it over to our clinical pharmacist. I almost called her a psychologist, but pharmacist, yes.
Thank you.
So thank you. You're absolutely correct. As a pharmacist, I do understand that, the same therapy may not work for everyone. So that's why we built in an appeal process. So if your doctor documents that you have to have this particular medication, the alternatives just don't work for you, that's what the appeals process is for. And they just have to submit that documentation and it will get approved. Our goal here, again, is not to keep members from getting the prescriptions that they need. It's just to make sure that we're making the most economically sense choice. Right.
And I just think that that needed to be said today.
But earlier, Mr. Chairman, earlier you said that that may take up to 72 hours, right?
That's correct.
Okay, that's all.
The review itself can take up to 72 hours, but it's all dependent on the physician. If the physician gets that information to our review team quicker, It can take anywhere from 2 to 72 hours. We just say up to 72 hours. And that's not, I just want to make it clear that that's what's in place now. That's not, we're not changing that. That's what you have in place right now.
And doctor, does that mean that it's Saturday at 6 o'clock, as the pharmacy is closing at 8 o'clock, that 72 hours starts at that moment?
The 72 hours starts from the time
Or
that,
working time, because I know Sunday, sometimes nobody's open.
right.
I just want to clarify it. That's all.
Yep, so the 72 hours is from the time that the physician gets that information to us to do the actual review.
And Suzanne, this will go in effect October 1st, is that correct?
Yes, and I want to speak to the what will happen before October.
Well, I was just going to say, I'm sure that if
Yeah.
she has a certain medication,
Yes,
she can start that whole process now,
yes.
you know, working with your doctor to go ahead and start documenting your needs. So when October 1st comes, that's all done and there'll be no interruption. So you have several months to work with Suzanne and our pharmacist here and get all that straightened out ahead of time.
Okay, and I
Okay.
will absolutely do that.
And
Good. Yeah, and please,
individuals
I
will be
encourage all of you, you know, if you're taking something on that list, you know, please get with Suzanne now and we'll start working on that to make sure there's no interruption of your coverage.
But to take that a step further, if the lady said that we have the same process now, then I would think that nothing should change what she's getting.
So the difference is, we have a prior approval process in place for certain medications. There will be additional medications added as a result of these programs. So it's the same process, but just an expanded threshold for that review to take place to further ensure that what the plan is paying for meets the appropriate medical necessity requirements.
And where can an employee who's on drugs now check to see if their drug is on one list as opposed to the other?
So we made these
Right here.
available, these
Okay.
lists available, and also every
Where can they get
employee,
that? Somebody, if an employee doesn't have one right now, where can they get one?
Contact Suzanne.
they can contact me,
Want to get the information?
absolutely.
Because there's some people sitting here who are worried about their drugs now. So I just want to make sure that they all have the information and realize that there's probably very little to worry about, but there is something they may need to do.
There will also be letters sent to each individual member who's impacted from RX Benefits in advance of the change, saying this is, your medication is on this list, this is what you need to do, and include the steps necessary to work through any issues. And then, as I mentioned earlier, we are going to implement this with a grace fill, so that if somebody didn't have the opportunity to work through everything, it allows another 30 days before they need to get all that resolved. So it should really help people be able to work through what they need to.
Thank you.
You're
And-
welcome.
And if someone has already gone through the prior authorization process, is that grandfathered in? Do they have to go through the process again, or?
So if they've already been approved for a medication,
Right.
this doesn't change that.
Okay, so they don't have to go through the approval process again?
Not for the same medication that they've already been approved on. Now, is there a time frame, a recurring time frame for updating information?
Yes. Typically, prior authorizations are good for 1 year, depending on the type of medication. There are certain medications that are only used for 3 months at a time. Some of the hepatitis C medications, for example, so those would only be approved for 3 months at a time. So typically, prior authorizations are good for a year, and then they have to go through the process.
Is it more of a streamlined process for a renewal, or is it?
It is. So the criteria is different. So the criteria for an initial authorization is more extensive. That's when we can really kind of make suggestions to the physician for lower cost alternatives. Once somebody's been established on therapy, it's very difficult we wouldn't want to disrupt them and try to move to a lower cost alternative at that point.
So getting the doctor just to renew the authorization is a lot easier
Much quicker.
process, and
Yes.
just maybe even a letter saying, I still think my patient should be taking this?
There's a standard form that the physician just sends in, and it's a lot quicker to get it renewed.
All right, thank you.
And the lists, I think we didn't have them for the first of the informational sessions last week, but we had them for subsequent ones. Oh, they were there for all of them. If we could make sure we have this available for all the constitutional officers, employees, and ours, and, put it in the newsletter or something like that. And I do want to say this is something I understand this could cause some disruption. We try to make it as easy as possible. The board staff recommends it. I think it's a way that we can save $400,000. What we're trying to do is manage our costs, because if you don't, it's just basically a matter of who pays what, and we see how that's going. When it comes to the employer and the employee both paying more, we're both paying more, nobody's really happy about it. This is an opportunity to try and bend that spend down a little bit, but board make a policy decision on whether you want that or not. And a lot of these things we're just trying to, for these RX benefits things, we're trying to manage those costs, trying to keep these future premium increases from being more and more. And then I do want to point out one of the things I know the sheriff is concerned about his employees and their compensation package, and I think he should be. But I would encourage the sheriff, because I know that this has been looked at before. The constitutional officers have the option of providing their own health insurance. They all are on the counties. So I would encourage the sheriff and any other constitutional officers that thinks this is not working, or there's a better mousetrap out there. Maybe there is a better mousetrap out there. I would encourage them to research that and look for other options, because they can procure health care separately from us. I think at the end of the day, it's better because we've got economies of scale with all of us together. But if something's not working for a constitutional officer, they do have that ability to procure their own health coverage. So thank you.
Ma'am, I think it sounds like you're probably going to be okay, so, and
Thank you.
those like you, so.
Thank you for bringing that up.
Anybody else care to speak on this issue? Name for the record, please.
Hi, I'm Emily Ensman. I work for the Indian River County Sheriff's Office in the Corrections Bureau. I just have a couple of questions in regards to funding and how the trust fund is funded on your part, and then a couple of questions in regarding the gold plan, which is the plan that I'm interested in. I thank you for bringing up the step plan option in order for us to pay for the increase over a 2-year plan. However, I don't think you went far enough and should explore additional breakdowns of that step plan to lower the cost to the employee at this time, because it's just overwhelming for a lot of people, especially those who have families. Also, along that line, if you're expecting increases for next year in that step plan, per se, let's say if we pay the $70 or whatever it was versus the $110 for a single coverage, and then next year our plan usage is higher than you anticipated, and you're still going to have an increase. What's to say that you're not going to have that same increase, even if we do it the way, just at the 1 year hit at $110 for the single plan? Next year is an unknown. You don't know what that is going to be, and you can't guarantee that an increase next year, if we go with just the plan as it's presented today instead of that step plan, isn't going to increase either. How do you fund that reserve, that 3-month reserve that's required by law? And how do you anticipate funding any increase that you want to provide for that reserve without affecting how the employee or the employers pay for that? Do you have any ideas of how you can do that without increasing our premiums? I'd like to caution the people who I anticipate paying for the gold plan, because that fits my needs the most, but I want to caution those who are looking to take what I think is a step down and choose the silver option. It may look good on paper to begin with, but if you're a family and you have children, or even if you're a single person and you anticipate paying less, it only takes 1 day for a health event to become catastrophic. You can be healthy on a Friday and come in on a Monday and have your doctor's office call you and say that you now have a problem. Or you can have a child who comes home from school on a Friday and has a cold, ends up being in an emergency room on a Sunday night with a 104-degree temperature and has pneumonia. You have a problem. Those costs will greatly increase your upfront cost and your behind front cost when you choose that silver option. And I want everyone here who's looking at that as an option for them, because they have less upfront cost, that it's going to be very expensive for them if they should have even just one event. One of my colleagues asked, have you looked at other plans? And I explained to her that we're self-funded trust, so that we are the plan. But have you looked at other insurance agencies besides Florida Blue that might administer the plan at a lesser cost? Have you looked at expanding our pool rather than Mr. Brown suggesting that elected officials separate from the pool? Have you looked at including other agencies within the county, Vero Beach Police, Vero Beach City, Sebastian, Fellsmere? I know the school district, and most of those people are very happy with their plans. Have you ever reached out to them or had a collaborative effort with the other governmental agencies in the county to expand our pool rather than make our pool smaller? An increased pool would lower the cost across the board to the individuals in that pool. And the last question I had was in regards to the stop loss and how you fund that. Is that part of our premium cost, or is that a part that the county board budgets for every year and pays for? I, for one, have a good relationship with my doctor and feel that in a health insurance plan or a pharmacy plan should not dictate what my doctor wants to do for me, to care for me. And I have a feeling that this is just going to get worse as time goes on, and that's what you're trying to force on us at this moment with the silver plan, not necessarily the gold plan, but with the silver plan. And the pharmacy plan that you're proposing is that you're requesting that our doctors consult our plan before they provide us with the service that we require. And I'm totally against that. I just think that is really putting an extra burden on us as consumers. You mentioned consumerism. As a consumers of this health plan, that we're not going to get the most benefit out of it. And I would highly suggest that you don't go in that route. Thank you.
Thank you. Jason, you want to see if you can address at least some of the questions, particularly about have we looked at other plans, the administrators? And
Okay, so on funding, basically, the funding is, there's a certain expense amount. I think we're projecting $22.8 million for next year. It's a mix of employee and retiree premiums, and the rest is the employer. So if we lower the employee and retiree premiums, the employer, who's the taxpayer, pays more. So I think that's one thing we need to remember. We're trying to balance this, that we're providing a competitive benefit for our employees, but also balancing the taxpayer's interest. And the less the employees and retirees pay, that dollar has to be picked up by the employer, which in this case is the taxpayer. Stop loss coverage is part of that $22.8 million. It helps provide protection. We hit that twice this year. I think twice this year. And so we get reimbursed if those claims go over $300,000 for an employee. Remarketing, we didn't this year, but last year we looked at different providers, United Healthcare, Aetna, and did an analysis. The broker provided an analysis based on different carriers, different providers have different discounts at different doctors. So they ran our system through to see if anybody else would be better. We didn't find a better a better provider that would provide a lower amount. Also, whenever you have a change like that, if you go to a United Healthcare or an Aetna, doesn't mean you don't do that, but you have disruption. So we talked about the doctors that we have. They may not have all of the same doctors that are on our current network, so you end up with disruption whenever you make that change. Doesn't mean you don't make a change, but we did evaluate that last year, and we decided that it was beneficial to stay with Florida Blue at that time.
Just a follow-up to your answer in regards to the reserve and any savings of that reserve or any of the money that we've saved on our pharmacy plan, where does that money go? Does it go back into the general operating budget as a whole, or does it go back into the fund?
It all stays right there in the health fund. We collect premiums, and those are put into the fund. The claims and the expenses are paid out of the fund. Anything that's left over stays right there in that fund. It doesn't go to the general fund or anywhere else.
And about how much is that a year?
It varies by year. For instance, we showed last year we had a gain of $144,000. That stays right in the plan. The year before that, it was a $2.3 million gain. That stays. The year before that, it was $1 million some loss. So it all stays right there. We don't take it and do anything else with it. It's its own separate fund. We don't put money into it or pull money out of it for other purposes.
And there was a mention at one of the meetings Suzanne did in reference to the money savings we got, the rebates we got for the pharmacy plan, that it was like $400,000 that we'd already received back. And 100% of that costs, does that go back into the plan as well?
Those rebates are paid back into the plan, and that's the way it's been. We're getting larger rebates now than we were. We got rebates before. There was a bit of a black box, and we didn't know the basis for those. Now, with the new provider we have, we know what our rebate should be. We know what makes it up, and it's a larger amount. So instead of it's double what it was before.
So even with that rebate and that savings that we made, switching from Blue Cross Blue Shield for our pharmacy plan and going to eScripts, we're still at a loss and require the premium increases and the change in our pharmacy plan to make us more efficient.
Correct. We deferred some increases, but there are things that are going on that are causing cost increases in addition to that.
Name for the record, please.
John O'Connor, International Association of Firefighters, President, Local 2201. There's been a lot of discussion today, and there was some comments previously about the reflections on this plan and what I think the words to use to describe it were good and sweet. I respectfully have to disagree. I think it's kind of sour. It's a hard pill to swallow. It's a huge increase based on the numbers that I'm seeing, and the county as a whole is not competitive in the marketplace by any stretch. I did a little bit of research the other day. 3 counties that we're losing the majority of our personnel to are St. Lucie, Martin, and Palm Beach County. Of those 3 counties, all of them work 416 hours less a year than any River County does. And they also make anywhere between 19 to 21% more in salaries than we do, from $50,000 all the way up to $51,743. Our starting pay is $42,469.70. That is a disparity, to say the least. The HR director had said that, yes, we're competitive in the marketplace, but we're not even close to competitive in the marketplace as it relates to salaries. Even Martin County has they pay $86 less than family coverage and make $8,000 more dollars than we do. How are they doing that and we're not? That's a good question as far as I'm concerned. Furthermore, we talked about the county administrator had talked about opting out of the plan. We actually proposed that in one of the last contract negotiations, and the negotiating committee on the county side did not accept that. Furthermore, we even were, during that impasse hearing in the 14 hours, some of the language was imposed/ratified to create the language that says we have to go to the doctor if we have more than 3 occurrences. So that in itself, the county has created its own cost associated with that. Lastly, this county, when I watch the budget hearings, a majority of the commissioners and staff tout on, I I think the last time I was at the budget hearing, you guys were the third lowest taxing district in the state. Is that right? Are we number one yet?
Haven't gotten to number one. We keep
Haven't gotten number one yet. I know you guys really are striving to get to number one, but at what cost? At what cost to the employees and at what cost to the taxpayers? Because we have, roughly 140 guys in the fire department that have less than 3 years of experience. So are we providing the best level of service to the taxpayers for that money? Or are we flushing the system every 90 days and then having to pay the overtime to backfill it and then trying to train all these guys to put more people back on the streets? So now I've got a guy in a rescue that's been there for 1 year, and he's in charge of a $500,000 piece of apparatus with another person that's been there for 1 month working on any of our family members versus a 5, 10, or 15-year guy that is providing a higher level of service. So I asked the commissioners to really think about a lot of these things because we have 20 guys right now that are slated to go to Palm Beach County within the next couple of weeks. And I was just at the state convention, and I had quite a few of all the organized labor down there that I met with. And they come up and they said, thanks. Thanks for training all these guys that we're getting because they're great. So we are basically subsidizing all of the counties south of us on the taxpayers' dollars and on the employees' backs. So I challenge you to do what's best for the employees, because we also live here, but also what's good for the taxpayer. So the lower taxing rates, they sound wonderful at the end of the year, and everybody thinks that that's great, but we're not even close to competing with what's going on. And furthermore, all of those people that, we have a vast majority of guys that don't even live here, all of those dollars are going out of the county into another county. Gas tax, real estate taxes, groceries, what have you. It's not staying in any of your county. So I would caution you and just pretty much, what am I trying to say is we're in contract negotiations with the county. There's a lot of people that are looking at this right now, and if this doesn't go good, they're out of here. So it's going to be 20 in the next couple weeks. It's going to be another 20 in the next 6 weeks. It's going to be another 20 in the next 6 months. So do we want to pay that money in overtime, backfilling all of those positions, or do we want to actually hold the line and be competitive in the marketplace? Thank you.
Thank you. Name for the record, please.
Bob Sunkel. I'm a detective with the New County Sheriff's Office. First, I just want to agree with what was said earlier about the silver plan. I don't even see that as a viable option. I would save about $120 a year on that, but one catastrophic event, and I won't be able to afford the 20% that it's going to take me to pay for that. So I don't even see that as an option, even as a healthy young individual. Then the other thing is, a lot of us became cops and firefighters knowing we're not going to get paid a lot of money, but the benefits were really good. That's why we did it. So now if we're going to get to the point where we don't have good benefits, we don't have good salaries in this county, as you're seeing with the fire department, as you're seeing with our department, we're going to lose all of our good employees. And the people that are going to be left to protect the citizens of this county, including you guys, is going to be the people who couldn't get hired at other agencies. Our agency prides ourselves on training here. We train more than any other agency on the Treasure Coast, and yet we're not benefiting from it. All of our good employees are leaving and going to other agencies because the benefits are better, the pay is better. So we need to do something to change all that.
Thank you. Name for the record, please.
My name is Jessica Ganowski, and I'm a deputy with Indian River County Sheriff's Office. I reside in Mr. O'Brien's district, so I'm also a resident of this county. I am your catastrophic event. In 2015, I got hired on with the Sheriff's Office, and I was perfectly healthy. There was nothing wrong with me. By the end of the year, I found out I had an autoimmune disease. You can imagine the cost that could occur to a family of 4. You have to think about what you're doing to the people that work in this community. We cannot afford to pay $400 a month for a gold plan. I cannot afford it. We're talking about if I get a raise this year, if I get a raise next year, it might cover the cost that you're talking about accruing in 1 year. 1 year. This is horrible. I was born and raised in this community. I plan on staying here forever. I plan on retiring with this agency. But it's becoming more and more difficult with these benefits that are no longer benefits. Paying $400 a month, you may compare to other surrounding communities. It is not comparable. We don't make nearly as much as they do. We are one of the richest communities in the state of Florida. Yet every time we ask for any significant raise, we are denied. And if we are granted, we are given a small percentage, and it doesn't even cover the increase in our health insurance. We work for this community just like you do, and we are a part of this community just like everyone else. We deserve fair care, we deserve to be treated just the same, and we deserve our fair share. We've worked for it, we've earned it. We respond to every call in this county, whether it be a fire, whether it be a death investigation, a murder, a suicide, a natural death, a baby drowning at 18 months old in water. We are the ones that go out. We are the ones that see people at their worst in this community and try and bring out their best. We deserve better from this community. We've given better. That's all I have to say.
Thank you. Anyone else care to speak on this issue?
How you doing? Chris Lesser, I'm a detective in the Indian River County Sheriff's, and some of what I'm going to say is going to echo what you've already heard, but I'm going to touch on a couple different points. I'm kind of new to the political game, taxes, salaries, things of that nature, but what I've heard today is mind-blowing. We are one of the top 5 richest counties in the state of Florida. What I just learned is that we're also one of the top 5 lowest taxed. What I do know as a member of the Indian River County Sheriff's Office is an adjunct instructor, as well as an adjunct instructor at the state college. We have the best officers, the best firemen, the best support staff that any entity in the state of Florida has. I go to these trainings, I help teach other officers, and I will take our average officer, our average fireman, our average support staff, and put them up against anyone else in the state of Florida, and we will win every time. So for those two disparities to occur, being one of the richest, one of the lowest taxed, and then deny Sheriff Darrell Lohr his budget to pay us properly is asinine. I stand before you as a deputy who almost lost his life defending this community. And for you guys to sit here, Miss Susan Adams, I'd appreciate it if you paid attention during this portion. It's asinine that you guys are going to sit here and say, you must now pay more. I can't afford to continue living in this county with things going up, pay staying down. So I appreciate everything that you're doing, but this conversation should have started in January, not now. Thank you.
Mr. Chairman? Mr. Chairman? Oh, one comment, since it's been brought up a number of times, and this is probably not the appropriate time, but there's a union that's blocking a significant raise to the rank and file at the sheriff's office that has been on the table for a long time, and
Commissioner Zork, that's fine. That's not quite the time and place for that.
today.
Anyone else care to speak on this issue? Ma'am, let's not go down the rabbit hole the wrong way. No, I'm just saying let's not,
Joseph,
that was a mistake. Let's not duplicate it because I don't
I
think.
apologize, Mr. Chairman.
Thank you.
Joseph Carmen, detective, Indian River County Sheriff's Office, who has served this community for 27 years, almost 28. I can tell you, Mr. Zork, that the union has not stood in front of the sheriff
Okay, Sir,
prevent-
sir,
prevent-
somebody took a turn in the wrong
I
direction.
understand that,
I
but-
apologize, it came from the dais, but if we could go back to the health insurance, I'd appreciate it.
Well, did Pandora open its box? or
I understand,
let it out?
we have to try to close the box.
Okay. And I agree. I can reiterate what every firefighter,
I apologize on behalf of the board.
okay, thank you. I reiterate what every firefighter, every cop, every worker in Indian River County says. Our pay doesn't represent what the increase in the insurance benefits are showing. Martin County Sheriff's Office is self-insured. They do pay a little more, it's like $50 more for family, but they have a free clinic that they can go in. If the med is there, they walk out with the med that's prescribed by the doctor. I'm sure we would not have a problem with an increase like that if we had that availability. I ask that you compare care to care rather than price to price, so that when we examine these things, we are comparing apples and apples and oranges and oranges. And just like the HR director said, you know, there's strawberries, there's oranges, there's fruit everywhere, because nobody has the exact same plan. Nobody has the exact health care needs, and I understand that. However, if we're going to compare to these other surrounding counties, surrounding agencies, let's compare apples and oranges to oranges, because the care provided for that extra $50 a month is night and day difference between what Indian River County care is. And that's all I ask. Thank you.
Thank you. Anyone else care to speak?
Jeff Smith, Clerk of Circuit Court and Comptroller. I just don't want the sheriff to sit out on Constitutional Island by himself, so I'll speak a minute. Smarter people than me have tried to figure out this health insurance crisis, and I know the predicament that you all are in. As an accountant, I can appreciate that. If it needs to be said that without the management that you all and Jason have done, we would be in a worse position. 2 years ago, my colleague in St. Lucie County was facing an employer contribution of 70% increase. And the board there decided to implement that over a 2-year period, so he was still facing a 35% increase on his share of the insurance. I would recommend at least go with Commissioner Solari's 2-year implementation plan to mitigate the effect on the employees. Knowing that in my situation, the lion's share of my employees are entry level, and any increase like this is going to be and I can't guarantee I can give any raises because on my court side I have to answer to the state. So it's not just an automatic that I can give whatever you all give to your employees and what I can give to my employees over here. It's not just automatic. So I have to answer to a state agency. But, and I'm sure that that's the workforce dynamic is going to be, if not already on your side and on the other constitutionals, as the workforce transitions from the baby boomers to the new generation. And so you're going to have a lot more people making entry-level wages that are going to have a hard time affording. And I understand that we can't put that burden 100% on the taxpayers. That's not fair to them either. But I just would caution you, and I would recommend at least go to the 2-year implementation. Thank you.
Thank you very much.
And Jeff, on that, you know, my concern is that second year catch-up may be more than where we are now.
Yeah.
And,
And,
you know,
and
so,
your point is well taken, Commissioner. It may be that anyway, though. You know, we're playing a risk game here, as
Right.
Commissioner Solari said earlier. But I think that with the way that, I know the history or the trend at least is not looking good, but with the experience and the expertise that we've got in this county, I think we can manage the risk as best we can. But I mean, for the employees, I think that's what we should consider.
and you know, one thing, at least I have to balance, is I know a couple people have mentioned that we're one of the wealthiest counties, but when we hear from the folks in Oslo and Gifford and Wabasso, they remind us that the Vero-Sebastian area has the biggest discrepancy between wealth and poverty. And we've got I forget the exact number, I don't know, Commissioner Zork, if you know, but I think between 60 and 70% of our kids are on free or reduced lunch. So we may have pockets of high wealth, but, looking at the entire taxpayer base, that isn't distributed as equally as you would think. And so any increases in the tax rate, the beach side may be able to afford it, but there's a lot of folks on the mainland side that becomes a financial hardship to them as well.
Correct.
And so it is a balancing job, and
I
there
know
is
you have a tough job, I can't.
there is a risk, if we do the two-step, what's the risk, what that catch-up number might be, but, so anyway, so those are just some of the things that are out there that have to be weighed and considered.
I want to address the recommendation that Jason made a minute ago about trying to find our own insurance. Clerks Association is in fact looking at that option, but that's going to be at least 3-4 years down the road before, even if they decided today to do that. I can't go out on my own. I've only got 90 employees, and it would be cost prohibitive for me to find insurance for my employees on my own, so that's not going to work for me now. It may if the Clerks Association decides that, because with 7,200 statewide employees, that might be an option, but it's 4 years down the road at least or more before they could, if they selected that option, before they could get that up and be competitive, so.
Thank you, Jeff.
Anyone else care to speak?
Commissioners, Darrell Lord, good afternoon again. I don't know much. I'm just a country boy from Ocala. I don't know much about politics, but I will say this. If we think about your silver and your gold, we're running our cars, or Chairman or Commissioner O'Brien, you're running your boat. You're putting 87 octane and you got the silver plan. We're putting the 93 octane, the gold plan. Chances are the 93 octane, the gold plan, your engine is going to run cleaner, longer, better mileage. The 87 in your automobile is probably going to get worse gas mileage and probably have the propensity of breaking down more. So let's think about those as our human beings. So now we have deputies and firefighters and road and bridge and others that have this thing that they're thinking, and this is the facts, and it shouldn't be the sheriff's office against the county, I get it, but they're thinking that we are being asked or steered into the direction of the silver. Now, that may look good, as Ms. Emily said earlier, on the front end, but then if you took the silver, there's a chance that, well, maybe, I've been hearing a little bit about this, maybe I shouldn't really go to the doctor, maybe I should put it off, running the 87 octane. And then what happens? What happens when the employer is sicker longer, the employee is sicker longer to the employer, versus being able to run on the high octane or the gold. I'm not in favor of the two tiers. I'm in favor of where we're at, which is simply the gold, and working with an infusion. This is the first time in 11 years that we've encountered this tier that I'm aware of. But I think short term, the county's assistant infusion from the reserve to satisfy the gold plan for all employees. Thank you.
Thank you.
And I'd like to talk about the employer cost at some point as well.
At some point today? Well, if it's going to be some point today, why don't you?
Yes, sir, Chairman. I saw the snapshot of the spreadsheet with the $350 for gold, and I forget the other price. I didn't see the employer cost on that, and the employer cost is obviously pretty significant.
They were on most of the sheets, but we can put it up again.
So what the scenario was that was put up there, that's not, we had looked at phasing the employer portion too. The board can go either way. Yeah, I'm easy to go either way with the board, do the whole thing that we had planned to do, or kind of do about 60% of it, a little bit over half of it. I can tell you that the employer contributions, as we recommended, would be an increase of 2.7 million. And the employee was 1.1 million. That's assuming a 60-40 split on silver and gold, and we don't know what that's going to be until we know what it's going to be, but until it happens. If we did the two-step plan as proposed at that same 60-40 gold to silver split, that would be an increase of premiums from the employees of about $350,000, and we were kind of phasing the employer side too, which would be a $1.9 million increase instead of the 2.7. The board can make a determination, do the full 2.7 now or the 1.9. I think the sheriff's concerned because he submitted a budget with a different employer contribution than what we ended up with here. The full bore would be about, I think it's about 240,000 more than what's in his budget. If we did the phase-in, we're within about 10,000 of what's in the sheriff's budget already. So if we do the phase-in, we could do a phase-in of the employer side too, which is a 1.9 million versus a 2.7 million. So I think maybe that's what the sheriff's looking for on the employer contribution. Is that what you're getting at, Sheriff?
Yes, sir. That of course, that's separate and distinct for our internal budgeting. And that ties in obviously to our July 17th hearing. So those are some things that I'm going to have to know. Obviously, our open enrollment is the end of June, quicker than most. But those things are something that I'll have to work on. Obviously, we're concerned about the employees as well. But the total picture obviously includes the employer cost with respect to negotiating on July 17th. So in closing, I'll just say that I think we should have one tier, and I think it should be the gold. And I realize and I understand Susanna's hard work, but this is the first time in 11 years that we've been approached with that. Perhaps this may be an item for discussion next year as far as the tiers go. I haven't heard the balance in the reserve medical fund. I don't know that number, but if we're above and beyond, this is the time, because we have, as you've heard time and time again, the employees' cost. And my fear is that the lower paid employees are going to take the silver because it reflects more in their take-home check. And to be honest with you, that's exactly what they're going to look at, their take-home, and roll the dice that perhaps they don't get sick in the next year. So thank you for your time.
Thank you. Jason, not that you would, but would you have the calculation ready if we want to see what it would cost if 100% of the employees were on the GO plan? I mean, what would that do to the rates?
So there's a lot of feeling. I see there's a lot of feeling out there, silver versus gold. We're agnostic to silver versus gold. The employer contribution is the same. So if we had 100 people, if we offered silver and gold and 100 people went on silver, 100% went on silver and nobody went on gold, or everybody went on gold and nobody went on silver, it wouldn't be a change in the expected performance of the plan for us. So we don't care if somebody goes silver or
It
gold.
would leave the published rates for the individual or family on the GO plan what the published rates are. In other words, that calculation, because I believe you based the employee share on 40% going silver plan.
Right.
So if they all went gold, that wouldn't.
Okay.
Is that?
Sorry, go ahead.
That wouldn't change what the employee would have to pay.
No. So basically, the difference between the silver and the gold plan, for single, it would be 110, or is the full, we'll just stick with the full recommendation for right now, is 110 for the gold plan, $40 for the silver plan. What we expect, based on the actuarial projection, is it would cost the plan $70 more a month on average for somebody to be on the gold plan. And so the employee's paying $70 more in premium. If they go to the silver, they pay 70 more. So
Either the employer would have to pay more if 100% of the people went to the gold plan, or what the individual employee would have to pay would have to go up.
Correct.
Okay, so I just want to be clear on that, because if we decided we all wanted to go on the gold plan, I, for one, wouldn't want to put that additional burden on the employee, which would mean that the employer share would have to increase to fill the gap rather than the individual employee.
I'm not sure I follow where you're going there. It's the same.
No, they're the same now, but I thought that Jason said that the total number was based on assuming 40% would go for the silver plan.
That's just on the employee premium. So if more people go on gold, we'll get more in employee premiums. If more people go on silver, we'll get less in employee premiums. But the employer premium is going to be the same.
Okay, so so nothing, that's what I want to get at. So nothing will change then for the employee share.
Correct.
Okay, that's just, I want to be clear on that myself before I went forward with anything.
Okay. Yeah, so if everybody went on gold, if half the people went on silver and half the people went on gold, it would be the same as if everybody went on gold for us. The employee premiums would stay the same, and the employer premiums would stay the same as what's proposed, yeah.
Mr. O'Connor?
I apologize, I forgot to ask 2 questions while I was up here. Have the property values come back yet, the percentage increases? I hear 4.8%.
Now that's the preliminary number. The property appraiser has to provide us a preliminary number on June 1. It was 4.8% was the increase.
And I heard the number 1.8 billion in property revenues, property taxes values, right? What was the number with that? So if all the property values in Indiana County increased by 4.8%, what was the increased revenue?
The increased revenue, it's I can tell you in the general fund, it's about $3 million in increased revenue. There would be another number. I don't have the number in my head there would be an additional amount for emergency services in the MSTU fund.
Okay, so the mill rate that's associated with that, there would be $3 million extra for the 4.8% increase.
Yeah, right. If we kept the same mill rate, the general fund would get $3 million more from the 4.8% tax roll increase. There would be another increase in emergency services. I just don't have that in my head. But I can say that the sheriff's asked for an increase of $3.9 million in the general fund, and we're getting $3.0 million. And there's all kinds of other increases that we've got going on too.
And the current mill rate for the general fund right now?
3.262, something like that, about 3.25 mils.
And the cap on that's like what, 5?
We can levy up to 10 mils in total millage.
Thank you.
Thank you. Bruce, be short, please. We've given you plenty of time to speak before, and we'd like to figure out, before we forget everything that's been said, what the best way forward might be.
I swear this one's going to be an easy one, Mr. Chairman. Jason, earlier we talked about the OPED funding for the plan. If I provide my information to you all or Susan or whatever, can I get that report over the last 10 years? I'm just curious to know, because you alluded to the fact that when I said to you that usually that is the biggest funding source of the plan, but you said it's not. I believe that's what you said.
Right, correct.
What is?
Employer contributions.
Okay. But it is okay to request this. I just want to go on record requesting a copy of that.
Sure.
For the last 2010 to 2018.
Okay.
All right, thanks so much.
I think maybe the confusion is, because that only goes to cover the retiree premium.
Right.
So
Yeah, it's not.
it is the biggest chunk of the retiree premium, but not the whole health fund premium.
Funding
I would
source.
agree, yes. If
Right.
you're talking about
Yeah,
just
so
the retirees,
yeah,
the OPEB,
Because I knew there was a split there with that funding, so I wanted to make sure that, I wanted to ask the question correctly because I may have asked incorrectly last time.
yeah, and I was thinking of the whole, I thought you were asking about the whole fund, and that wouldn't be the OPEB contribution, but for retirees, the OPEB contribution would likely be the largest amount, yeah.
Very good.
And Bruce, just so you know, Jeff actually manages that fund for us, and he puts out a quarterly report that's on our website, but he does a very good job managing that, and, he follows an investment policy for that and things like that, but he brings that to us quarterly.
Best practices. Okay, thank you very much, you all. And again, I know you have a tough decision to make here, but, I don't envy what you have to do, but thank you again for all your hard work, staff as well, and all the stuff you all put into this as well, because I know it was not an easy task here, so
And if you give your email to Suzanne, we'll get that to you.
thank you very much.
So, Mr. Chairman, if I'm correct here, we currently have about a 13.1 million fund balance, and if we lose the 700,000, we'll still have over 12,400,000 in the reserve. And what I would like to propose is And Suzanne, my calculations, we have roughly about 700 single and 953 okay, well, let's just take the numbers you had, 1,652. I was trying to make my calculation here, but.
Take your shoes off.
700 single and 953 family is what is a good approximation.
I don't, well, I would go ahead and go along with the suggestion that we do a two-step phase-in with the caveat, and I hope everybody out there is listening, that second-year catch-up could be a bigger bite than we're looking at now, just so everybody knows. But in an attempt to ease into this and a little more, less impact, that we go with the two-step phase-in for the premium increase.
Okay, I can certainly second that, but I'm going to announce, I'm not going to make a motion as chairman, but I'm going to offer up something that maybe someone will move after you, but I don't want to conjoin them with yours. I want to keep the motion separate.
Okay.
So there's a motion from Commissioner O'Brien, second by Commissioner Solari. Any comment from the board? Yes.
Under that proposal, could we have distributed all the employees quarterly updates of kind of how the fund balance is going forward, so everybody kind of gets a read on how things are performing as it goes forward?
Just to pick on the language a little bit, instead of saying we'll give to all employees, can we make it available on the website?
Or some public place where everybody can be
That's all I just want
up
to,
to speed.
yeah, and it could be actually that it's in the newsletter. That would be a fine place. But I think in my second motion, it's going to deal more with communication and other things related to healthcare, so we can add that there.
And I would encourage Suzanne to try to get as much information as we can to the employees about the consumerism thing.
And that's going to be my second motion too. I'm in the second
Okay,
motion.
then I'll just stick with
That's,
he loves long motions.
I'm going to offer up a suggestion for a motion.
And one last question, Mr. Chairman?
Yes, sir.
Under this motion, if we see additional savings come in, and maybe this is covered under your second part.
That one's not.
Okay. If we see all these programs that we put in place under the healthcare umbrella, and it's really helping control cost, and we're bending the curve of the increase and seeing somewhat of a plateau, and we see the fund balance increasing, I personally would be okay with sharing that in reducing future premium cost, as long as we're staying ahead of the curve on our fund balance.
I think that would be our normal goal. That's what we've done in the past.
Right.
Yes.
We've tried to minimize the need for any increases year after year after year. Unfortunately, due to some catastrophic events and stuff, we were put in the position where we have to this year.
Right. Okay, thank you.
Any other comments from the board members?
I guess I can count to three, but I think this is going to leave an indelible mark.
Okay. So with that, we'll take the vote. All in favor of the motion by Commissioner O'Brien?
Aye.
Aye. Any opposed?
Aye.
Passes 4-1. Commissioner Flesher dissenting. Now, I'll try to articulate this motion so you can, so if anybody wants to second it, they can understand what I'm saying. But I'm going to start with the fact that the whole healthcare issue is very complex. And it doesn't seem to me that it necessarily is going to be better. It's going to have to be managed even more than it is now. And I think you've done an exemplary job, but it's a very complex thing. So we had heard a lot of ideas today, which may be useful in the future. I've never been one for a clinic, for example, that's government-owned, but it may be because of changes in the health field, that's something that needs to be looked at. So I'd like to see if we can direct the county administrator to have Ms. Boyle look at almost every possible thing that she can, again, with a fresh look, including the idea of going towards more technology or discussions with healthcare providers to push more technology. For me, one of the problems is we now have so many different aspects as employees. We've got a flex fund possible. We've got the dental care. We've got the health care. We've got the prescription card. I don't know how it all works. And I think there are probably other fellow employees that don't know how it all works. So I believe that we're going to have to do more in terms of education. I mean, I understand I'm going to have to do more because it's dangerous. So, but I also tend to think that this may be more work than Ms. Boyle can do by herself. So I, for one, would actually, in this case, because the costs are going up so rapidly, support an additional person for Ms. Boyle if that's necessary. Because I believe that to get this done, it's going to take a lot of time and a lot of energy. So we've got to then explore every possible option, explore technology, communicate as well as we can with our employees in every way, try to push consumerism, but that's going to take a lot more education, especially at the start, because we don't know how to push it the right way as individuals, I don't think, and it's very, very complex. So to say consumerism, what does that mean? I mean, for me, I'd like to have our medical options be like going on Amazon. I put in the product, I put in whatever, I get 16 different locations, and I pick the one that works for me. It's clear, it's simple, it's easy, but it needs to be that way for our employees. And clearly it's not, and it's not going to be soon. But I mean, that's the way I'd like us to go, because again, we've had this conversation briefly, we no longer deal with the healthcare industry, we deal with a medical procedures industry. And we've got to be part of the push to go back to healthcare, where the goal is to have healthy individuals and not getting all this administrative paperwork done the right way. So I'm hoping that that possibility of a motion was clear enough to my fellow commissioners, and would be happy to discuss it.
Move whatever you said.
Right.
We have a motion from Commissioner,
If Dylan got it all down.
we have a motion from Commissioner O'Brien, seconded by Commissioner Zork. Commissioner Adams?
I have a question.
Yes.
When you talk about adding an additional person to help Suzanne, are you talking about a staff person?
Yes, I'm talking about a staff person, or if it's best to get some consultants, but, you know, to roughly that amount. But it needs to be, I think it needs to be a staff person, because it needs to be somebody who's going to communicate regularly with the employees of Indian River County. And most probably, a consultant won't be in that position.
Go ahead.
If I could just, there are ways to leverage our current resources, and we have a lot of partnerships in place and a lot of support that we can pursue. There are providers in place that can provide, we call it a concierge type service for members when they're facing a medical situation and they might need some help navigating the waters and selecting a provider, understanding more, you know, it's almost like just-in-time training for my healthcare situation. Is that kind of along the lines of
It could be.
helping?
Again,
Okay.
now you're asking a question about somebody who knows too little about the healthcare
Sure.
and how it works. It's like asking me a question on technology.
So I will just to let you know, we will not just say add a position. We will pursue the most cost-effective and efficient manner by which to provide the level of support and information to our employees without increasing costs or keeping cost increases to a minimum.
That's fine, but if you need, my point is,
appreciate
if
that.
you need the resources in
Yes.
this year's budget, so that a year from now, the job can be gotten done better, then I'd rather see the money in the budget so that we can attack this problem very aggressively.
Well, I would rather you talk to the partners that we already have, see what they can do for us under our current agreements. And if for some reason they're not able to provide the support or information that we need on this fact-finding mission, then we can have a discussion about adding support, whether it's consultants or staff. If that's included in this motion, I'm just uncomfortable with voting for it.
Absolutely. I just want to see money in this budget this year, so if it's necessary, it can get done. So in other words, I don't want anybody coming to Jason and saying, these are the type of things we need, these resources that we need, up to a certain amount that's in the budget, and have Jason say, well, it's not in the budget this year, it's got to be next year. It doesn't say the money has to be spent. I just want it available so that there's no pushback in any way.
No, I understand, it's
But
very
no,
unclear to me where that would, what that would mean. So I would rather have that
Well-
as, if we need it, let's have another discussion and bring it back, as, even if that's, I mean.
So, yeah, so if I could clarify, I think I'm getting direction that we think this is important as a board to get this done. And if I believe that we need a position to do that, I can bring that, but there may be other options to do that.
Getting the work done to do the type of things that we.
You're taking my excuses away from me to not get it done. So, so I get it, yeah. We'll make sure that we get it implemented at the end of the day.
Thank you.
Is there a targeted goal of some preliminary, in 3 months or some time frame to at least say, a clinic is something worth exploring further, or it doesn't make any sense, that's off the table?
I think the direction is that, I think that we understand if there's going to be any change next year, that we need to get out in front of it earlier, so that the information gets out earlier. But again, I want us to be in the position where, at beginning of June next year, we have had some discussions on this. We have a clearer picture of what the options are based on the most recent data and information that's out there, and that we can make the best informed choice at that time as possible, based on a lot of different options. And based on, but having meantime communicated the issues, both for and against different things, dealing with healthcare to our fellow employees, so that they have a better understanding, just like we will have a better understanding of what the issues are and what we have to do to improve things, and so that they can individually start making different decisions too. Maybe moving in the direction of better consumerism, or understanding that other information is available that they never, that I never look at, that we never look at. So, there's an article in the Wall Street Journal the other day talking about finance. And it said in it that everybody ought to spend 2% of their budget becoming more financially literate. I think the same thing applies to healthcare. I think we all, as individuals, need to consciously say that healthcare is of such important in my individual budget, and is such a big piece of that budget, that I have to dedicate a certain amount of my time and energy every year to understanding it better. I'm not there yet, and my guess is that most of us aren't there yet. But I think that, unfortunately, that's somewhere we need to be.
And when you get there, then it's changed and you got to get there again.
Learning is a constant activity.
Yes.
So what I think we'll want to do is I'm hearing we need to communicate with our employees before we come to the board for a decision point next year. We're going to build that into the process.
I think we need to start communicating with our employees now.
Correct.
But when we get to what we're going to be offering before the Board of County Commissioners next year, that process with our employees has got to start earlier.
Correct, and I've got that message, and we will do that. I'm a little leery of there's a lot of things that we've looked at. We talked about clinics or spousal surcharges and things like that. There are a lot of things that get looked at that do not come before you. I'm a little worried about over communicating things that we might take a brief look at and then decide that's not because I don't want you guys to get phone calls of saying, do you see what can you imagine what they're so we need to manage that process a little bit.
You need to manage it, and you need to have judgment. But again, if we talk about something like consumerism, it's not enough, and I don't think it gets us too far to talk about consumerism today if we, the employees of Indian River County, don't get some tools to be better consumers. That type of thing.
And if you could include in the motion, if any of the constitutional officers think we're doing a terrible job running the health plan, encourage them to get something better. Because I'm a little tired of folks who come here that want to make you guys into the bad guys and don't want to take ownership, because they do have options. They've looked at it in years past. They've threatened to leave our plan in years past. I think if they can find something better, the sheriff's office owes it to their employees to look at those other options.
I'll leave that to a fellow employee if they want to fellow commissioner if they want to make a third motion. But we have the motion from Commissioner.
Mr. Chairman, I'm hearing all the chatter and fog of discussion. I don't necessarily know if the motion is clear. I don't know if the counselor would appreciate a read of direction. I know that the clerk will, yeah, I was seeing a nod, And I don't know if there's actually a clear motion on the floor, all due respect, because it was just chatterized back and forth, and I think some people want to get involved, but they don't want to get involved because they don't know what they're...
Try to restate the
So
proposal.
now we all jump in on something, and then we have another collateral damage about the poor guy that wants to come to work after being out for 3 days, and for 3 days, and within the 90 days, he's got to spend $400 if he wants to come back to work. That's what we accomplished today. I feel great. Okay. I'm sorry, I had to say that. I really feel bad for that guy. Because he's got to come back to work, and we're telling him that he's got to go to a doctor to bring in a note, otherwise he doesn't get a pass, and we might punish you. And then he's got to pay because he can only afford the silver plan. Maybe not this year, maybe next year. I don't know. Maybe the market will be different. Maybe the consultant will see something different. And then now everybody gets wages.
I think that's a matter for collective bargaining.
Sorry.
That's something in our collective bargaining contract.
I understand that. No, that guy got me, okay? Because I felt
So
bad.
what
I'm sorry,
doctor
counsel.
did he
Thank you
cost
for the caution.
$400 to go visit? Because it's
Again,
$35 to visit a primary care physician on the silver plan and $25 on the gold plan.
Again, I think Jason made a good
All right.
point.
Okay, that's all.
This
Point
is a
made and we're
issue for
done.
collective
Okay.
bargaining.
Hey, I want to leave a mark.
State the motion that's on the floor.
Yes, what is the motion?
Okay, so far, I'm going to restate
And-
it for the sake of,
I will defer to the chair who proposed the motion if the chair would like to provide it, or if you would like me to attempt to summarize, I'd be happy.
I'll let you try to attempt to summarize, and I'll add or subtract if I...
What I heard was a motion from Commissioner O'Brien, which is second by Commissioner Zork. And the general framework of it was to direct the county administrator to work with HR to basically try to explore all the options that are available to try to reduce costs and to make sure that we are consistently communicating with the employees of Indian River County and our constitutional officers about the options that are out there.
Correct.
And to include funding in the upcoming budget that if additional support is needed, then the funding for that position will be in the budget.
I have a problem with that.
Me too.
Because I think that that's the second step. We need to find out where we are now and what options are out there within what we have, because we've just heard from people that are gonna want
We have
raises
things-
and all sorts of things, and now we're talking about funding another position that
No, we
Suzanne
didn't say
doesn't feel
position.
she needs
She
at this
didn't-
point.
She didn't say position, just resources are available. We have that in the budget by the tens of millions. We have it in the budget for roads, for capital expenses, for all sorts of things, and we often don't spend it, and we have a budget carryover. So that's the same thing. Do not say there's no direct...
I would just prefer to have a separate discussion during the budget process about anything that needs to be included in future budgets. And by then, we should have some information about what possibilities are out there, and we'll be able to better understand what kind of budgeting we might need to do. That's all.
And just Commissioner Adams, my only thing there is, I don't think Suzanne will have all that by July 17th.
Exactly.
And so it might take 3 or 4 or 5 months before she can analyze everything enough to say, you know what, I really do need someone to help here. And by then, we're already, locked in the budget. So this is contingency funds.
I understand, but how much, then how much? How much is that?
If you want a specific amount,
I really don't even want any, but I think that if you're gonna have it in there, you need to have a specific amount.
Okay, $100,000.
Then I can't support the motion.
Why don't you just, I get the direction, and if we need resources, I'll bring something back to the board at a future date. I don't anticipate needing a position for this. I think I've got the direction. We'll make it happen within the budget. And if I need something else, I'll come back to the board.
I would be happy to support that.
Your motion, go ahead. What do you want to do?
We can strike the funding.
Fine.
And I'm okay with that as a second.
Good.
Yeah, that sounds pretty good now.
So I think we have...
So the things you said without the funding part.
Excellent.
Any other questions or comments? Anybody from the audience want to comment on this motion? If you'd want to come up to the dais, please.
You said that you're gonna do a 2-year phase-in. Originally, somebody put 8250, because I'm only gold plan. I don't even believe that there is a silver plan being offered, because everybody said is right is the front end on the back end and the 30% of the radiology and all. But what is the 2-year phase-in? Is it on the 400 for the gold plan family, or is it on the 8250? You said 350 you put up there. Like, I don't understand what's the 2-year phase-in amount based on, because I don't think that was clarified unless I missed it in all the jabbering.
Scott, can you put that up, those premiums, and maybe zoom in on that?
And thank you to Commissioner O'Brien for offering that, because as a family, we live hand to mouth. And we have side jobs in order to pay for kids' co-pays. And I have 2 kids that are on the $1,000 threshold that are gonna have to be re-reviewed, which we just did May of last year. So I'm just trying to see what's the 2-year phase, and so when I leave, I can tell my husband which one of us has to do more work to pay for us.
So right there. So the gold plan would be $85 for single, $350 for family. That's an $82.50 increase on the family from the current year. And
$350, and that's a 2-year phase-in?
that's the first year. That would be, so instead of going to 400, we'd be doing 350.
So then next year, you could come back for another 350?
No.
For the total of the 400?
If nothing changed, it would be a 400 total next year. So it would be 350 for next year and then
So
400.
I kind of feel like when you came here on the 4th, because you did kind of surprise attack, whoever said that from the firefighters, I think it went in a Friday agenda to come for a Tuesday vote. And thank you to Commissioner O'Brien and Commissioner Flesher, who said, hey, let's get the word out and let's do some workshops and let everybody know, because we did throw this whole pharmaceutical thing like just down their throat. And I really apologize to the retirement people specifically for the presentation that was given at the sheriff's office, because there wasn't anything about the retirement on the slide. It still is not. And I really feel like our guys, our retirees, somebody had made the comment that they move out of the area, or maybe they're old enough to go on to Medicare and stuff. And we had a guy sat here for almost the whole thing, and he's a 27-year, and he's SWAT, and he had to leave to do a 4 o'clock briefing. And I can't stand to think that he's putting a kid through college, and when he retires, he's going to get squeezed out of the plan, because it sounds like their rates went way up, but we weren't really privy because it wasn't in the PowerPoint. And so I want to say thank you for your service to our retirees, not squeeze them out, or they shouldn't have secondary and they should do this. And one other thing is, to the lady from the pharmaceutical, you said so they could cure their diseases. Some diseases can't be cured, they're maintenance drugs. So just to clarify that. And so somebody else that said, oh, they're young and healthy, or they're young so they should be healthy. Young and healthy doesn't equate in my house. I have a 21 and a 26-year-old that have a chronic disease, and I'm the one that came up at the June 4th. I'm the one that dings the program, and I'm sorry, but thank you for everyone for putting it on their backs and helping. So $350 for this year, and that's gonna be, your contribution stays the same, or you're moving yours up to make that other $50 that I'm not paying?
But your contribution is decreased.
My contribution was gonna be $400. Instead of $267.50.
It would be
There are reserves right now, so the gap will be filled by the reserves.
Okay, so you're not ending up any more, but then next year I do the other 50. Okay, thanks, I just needed clarification.
So we have a motion on the floor. It's by Commissioner O'Brien, second by Commissioner.
Thank you. One more public, Mr. Chairman.
On motion,
Comment on, well, it's more of the discussion. We just had a 15-minute discussion on a proposed $100,000 for another employee. Why couldn't we have taken, hold on, let me finish. Why couldn't we have taken that money that you're talking about and applying it to our insurance to drive down the cost? It sounds to me like y'all was wanting to spend more money for what?
okay, if we did it that way, then the savings to each individual employee over the cost of a year would be about $10. I'm hoping that Ms. Boyle will have listened to everything everybody's said and used the money to help explore all the available options, if there are any, and come back next year with a plan that won't require us to add that extra $50 a month to every employee who's on the GO plan. That's why. Sometimes if you're able to
Said
do.
it a hell of a lot better this time than you said it the first time.
Any other comments? All in favor?
Aye.
Any opposed? Passes 5-0. Thank you very much. Thanks, everybody, for.
If I can clarify just the first one again, the first motion was 4-1 with Flesher and dissent. That was O'Brien Solari. Basically, it incorporated the staff recommendation, but with the phase 2, which includes, is that, I just want to clarify that that was the motion.
Was that staff recommendation, but phasing it?
Okay, good, thank you.
And then Suzanne, if you could get it, or Jason, get an updated table, very clean and easy for them to understand what the new premiums are gonna be with the 2-year phase-in,
Yes.
so that we can get that out to them right away.
And if I could just say, I can tell you that we will definitely take everything that you've directed us to. We will go back. Jason has been very supportive, and I believe we're going to be able to have some solutions in place for the upcoming year, and we will do better job at communicating with our employees about the status of the fund. And I thank you.
And that's on me that we didn't do a better job of communication this year.
And I'd like to thank you for all your work in a very, very difficult subject. And I wish you luck in the next year as you prepare for what will
Yes.
undoubtedly be a lively discussion next year.
Yes, thank you.
Thanks. And with that, let's just take a 5-minute break, and we still have a bunch of the agenda to go through, and we'll see if we can't work through it reasonably quickly.
Sounds with that.
More?
Might have to like put floats on your
5 PM and time to continue the Board of County Commissioners meeting of June 18th. Commissioner O'Brien wanted to.
Thank you, Mr. Chairman. Since it's after 5 and I don't want a lot of staff sitting around piling up overtime, I'd like to make a motion that we table item 12F2, which is the update on sea turtle nesting, and that we table 12G3, which is the update on the amnesty and refund and relinquishment of reserve ERUs. And then I'd like to go ahead and move staff recommendation, item 12E1, which is permission to advertise for modification to county code. Item,
Hold on for one second. 12E1. Okay, 12E1.
yep, 12E1, and also move staff recommendation on 12G1 and 12G2.
Second.
Very good.
And I can repeat those again for you, Dylan, if you need, or the clerk.
Go ahead and.
You're good?
It was to table 12F2, to table 12G3, and to move staff recommendation on 12G1 and staff recommendation on 12G2.
And staff recommendation on 12E1.
Thank you very much, and 12E1.
That's the motion. That's the second? Yes. Any discussion?
Anyone from the audience?
Anybody from the audience wish to discuss this? Any of these items that were just mentioned by Commissioner O'Brien?
This is to approve extending the Wabasso sewer line.
I'm just going to say I'm here on behalf of Arthur Rigby. He's the president of Wabasso Progressive Civic League, and he had a kidney transplant, so he just told me to come here.
We wish him well.
And wish you and that we approve the project. And when two people work together, it's just great unity. That's all.
Thank you very much. Any other comments from the public? There being none, all in favor?
Aye.
Aye. Any opposed? Passes 5-0. Thank you very much, Commissioner O'Brien. With that, we go to 12A2, consideration of modifications to regulations for off-site accessory landscaping services uses in agricultural zoning districts. Mr. Bowling, Mr. DeBloy, welcome.
Thank you, Mr. Chairman. So on March 5th, the board heard from Mr. Simmons and Mr. Campbell, who live along a stretch of 37th Street regarding a landscaping services business, which is actually under code enforcement action, and they expressed concerns about traffic and other items, and especially looking at the precedent for similar businesses in agricultural areas, and the code enforcement case was also discussed. Just in terms of where that's located, it's located in an area that's zoned agricultural, where you can see here where 37th Street would be. There's just about a 10-acre parcel there, and a landscaping services business that had gone in fairly recently. It's in an area that's zoned agricultural, and there are a lot of 5 and 10 and 20-acre parcels in that whole area. And at the March meeting, the board expressed concerns about the possibility of gaming the system, in that if you could have a landscaping services business that didn't have much wholesale nursery associated with it, when in fact the landscape service is supposed to be accessory to the nursery activity. And so the board directed staff to look at possible modifications to our land development regulations to balance agriculture and business in ag areas. And staff has conducted research, and we put that all in our staff report and in the attachments. And we've drafted a proposed ordinance for you all to consider if you want to move forward with. We've also explained in our staff report that you could use that ordinance as a pending ordinance. I'll go into that in just a little bit. And staff's not aware of any new landscaping services businesses that have been established since the March 5th meeting. So as far as we know, nothing has changed in terms of the data that you're looking at. In terms of our agricultural areas, about the western 2/3 of the county is agriculture, and east of 95 in the A1 areas is where you have kind of this blue-green color. It's many square miles, and that tends to be where you have the most conflicts, like the kind that has been discussed with the landscape services businesses. You still have those in some of the other areas that are A1, but especially we tend to see the conflicts mostly in east of I-95. And we have a lot of the conflicts because we've got a number of uses that are a variety, including sort of a low-density residential, as well as a lot of different types and intensities of agricultural uses. Did want to point out that the state has a lot of preemptions constraining local regulations, including site plan and building permit review for any bona fide ag use, but it's also kind of been expanded over the years since 2011 to apply to some of the uses that are associated with agriculture. Currently, we have a voluntary verification form that we use in the county that a property owner who's claiming a preemption can come in and we can document and record what they consider to be their preemption. And we can kind of keep track of things that way. Right now in our agricultural districts, A1, A2, and A3, we allow commercial nurseries that are wholesale, and off-site landscaping services are allowed as a component. Staff's interpretation has been for a number of years that the landscape services component has to be accessory to the wholesale nursery use. And our definition of accessory doesn't have anything really quantitative in it, but it has to be incidental to the primary use, which in this case would be the wholesale nursery, subordinate in purpose and area, and located on the same site. And so really kind of the quantitative measures or the easy measures really deal with area, and that's sort of what staff's interpretation has been, that landscaping services site area has to be less than the nursery site area. And we've conducted research, and we've put that in your backup, looked at a lot of different characteristics of existing nursery landscape services businesses that are in the A1 area. There are quite a few of them. There's 17 that we found. And we looked over various aspects of those businesses. I'm going to turn it over for just a moment for Roland DeBlois to go through slides. You can go ahead, Roland, and these are basically aerials of the existing businesses. And you can just see, quickly that there's a lot of different coverages and kind of layouts involved with them.
Thank you, Stan. And again, we're just going to go through these fairly quickly. There's 17 of them, but just to give you kind of a visual overview of what's out there. This is the Willis Family Farms on 58th Avenue. It's about 18 acres. You can get a perspective of the cultivated area versus the buildings and drive and parking areas. Peterson Grove on 66th Avenue, 13.7 acres. Oslo Oaks Landscape, Inc. on 17th Street Southwest, 8.8 acres. Anco Land LLC on 8th Street, just under 10 acres. Tropical Property Management at First Street Southwest. The overall property in the red box is 19.4 acres. A Jordan Sprinkler System out west on Oslo Road, just under 10 acres. Treasure Coast Turf and Trees in 37th Street, 6.9 acres. Premier Landscape Solutions at 33rd Street, just over 6 acres. J&D Property Management and Landscaping on 17th Street Southwest, just over 16 acres. Chestnut Property on 65th Street with ornamental nursery plantings, 10 acres. Creative Landscaping and Lawn Maintenance on 57th Street on the 15 acres. Caribbean Lawn and Landscape on the 37th Street, just under 10 acres. WW Sod and Equipment Company on 61st Street on 12 acres. Hardwood Tree Farm on just under 5 acres in Fellsmere off of 138th Ave. Ritno Nurseries on 49th Street, just under 5 acres, includes a residence. Indian River Landscape, 12th Street, just under 10 acres. And then on a bigger piece, Sebastian River Farms LLC, on about 200 acres off of 82nd Ave.
So Staff looked at existing and potential regulations. We noted that adjacent counties, including Indian River, allow landscaping services in agricultural districts as a permitted use with no specific criteria, except Indian River County treats it as an accessory use. And Palm Beach County has some criteria, kind of minimal, but they have to be accessory to a nursery. They have a minimum acreage and some landscape buffering in circumstances, really as it kind of relates to residential properties. So in our report, we describe some justifications for quantitative standards if that's the direction the board wants to go in for regulating. Again, looking at the constraints that we have with preemptions. And we took in this draft ordinance, a kind of a definition approach to qualify what constitutes as an allowable landscape services use. We did that instead of putting it in as a kind of a conditional use with site planning, because a lot of the uses that we're talking about here would be preempted from going through the site plan process. So we tried to make either it qualifies or it doesn't sort of approach. And again, it's a draft ordinance, and it could be something that you put into place under a pending ordinance type of action. So the draft ordinance does a number of things. It clarifies, makes it crystal clear that the landscaping services business in this sort of situation would have to be accessory to the nursery. It defines landscaping services as installing or mowing, trimming, maintenance activities associated with landscape material. And landscape material is broadly defined, including grass and lawn, also shrubs and trees and other ground covers. As drafted, specifically precludes pest control services, excludes further regulation of small-scale businesses conducted under a home occupation permit. Wanted to make sure that did not fall into this category because those are smaller scale. Specifies that the nursery must be established for the landscaping services business to be conducted, and it would specify a site size of 400,000 square feet, which is just under 9.2 acres or larger, so that it's on a fairly large parcel. Again, this would be under any of the agricultural zoning districts. Also, a 50-foot setback would be in the regulation, to a setback that would apply to parking, driveway, or building area that applies to landscaping services type of facilities. It would limit landscaping services site area to 50% of the nursery site area, so you'd have twice as much nursery site area as area that's devoted to the landscaping services facilities. Also be a requirement to visually screen the parking area associated with landscaping services, screen it from adjacent properties and streets, and would specifically prohibit burning, mulching, or dumping off-site debris on the nursery landscaping services site. That's already staff's interpretation. That's been backed up by code enforcement action in the past, but thought it'd be good to put that in kind of the qualifying definition. The pending ordinance doctrine would mean this: if you all choose that you want to pursue a regulation like this and have staff go through the formal process, you could declare the draft ordinance to be in effect basically starting now during the formal code enforcement process, code change process. The code that comes out of that process could be more stringent, less stringent. You could decide to not do it, but it would basically put that into effect now. That effect would not apply to any existing businesses that were out there. It would apply to a new business. They'd have to meet the criteria if you took the pending ordinance action today. Also, if an existing business were to expand, the expansion would have to meet the requirements if you put them into effect today. And if there were any changes that, for instance, if you say you moved a parking area closer to a perimeter or something like that, that would be something that could be controlled if you decide that you want to put the pending ordinance into effect. Staff's recommendation is to consider the ordinance, give staff input, and direct us to initiate a formal LDR amendment process. If you want more specific regulations on this, that would be the way to do it. and also to invoke the pending ordinance doctrine, to put the draft ordinance into effect during the formal amendment process. I could see the formal amendment process, probably taking 4, 5, 6 months, something like that would be my guess. That's staff's presentation. Be glad to discuss.
Thank you, Mr. Bowen. Any questions for staff? Mr. O'Brien?
Thank you, Mr. Chairman. So Stan, one, the accessory uses of going along, and the primary use is a nursery. I have a hard time connecting the mowing and trimming to somebody goes to a nursery, you buy a tree, and they come out and they plug the tree in the ground for you. I get that part, but I don't see where the mowing and stuff comes in as an accessory use to a plant nursery.
Right, it's a matter of degrees. What we see is that typically when we look at the allowances of other counties, a lot of them specifically allow mowing. And that is a major activity with a lot of landscaping services. They can install sod, they sell sod, they maintain mowing, and so that's kind of customary as we look around and look at landscaping services business that are in business now and what we see allowed in other counties. And again, I just say that because it's a matter of degree. Does that mean everything to do with a lawn or tree is now part of a service that's allowed? And that's part of that spectrum that you have to look at with a regulation.
Okay. And then the definition of a legally established nursery, what is the criteria? Does it mean product ready to be sold? Because I could go out and get 400 live oak seedlings this big, and they won't be ready for sale for 20 years. But does that mean I have a legally established nursery because I got all these little seedlings out there? Or what's the criteria to be a legally established nursery?
Right, and we're not proposing any with this ordinance. That's quite a drill down. I mean, what we look at, you really just have to kind of use your judgment. What we've tended to see is nobody go to that extreme. We see containerized material. We see sod. We see a lot of trees that are put in at probably different stages of growth. But certainly a lot of them would start out small. So you could certainly have a nursery established. Put in the infrastructure for it, irrigation and that sort of thing, which is quite an investment, and to get it started. But you could certainly start with small plants, and they'd have to be spaced reasonably. Sometimes we look to ag extension to kind of get a feel for what's not spacing them 100 feet apart, that sort of thing, like a real nursery sort of layout. So we use those factors when we have to go out and make judgment calls on is that a nursery that they're establishing.
So it's kind of, it when you see it, like good art?
Well, we bring in an art expert.
Okay, that's all I have for right now.
Thank you,
Chairman. Yes.
Mr. Zork.
And looking forward, I had a conversation with some folks that are a little ways down the road from doing something, and I think this would still comply. They would be processing a agriculturally grown, not a fruit, but another type of something that would be grown 4 or 5 years before it would harvest. And then they would process that growing inside some type of new facility. So that would be, as long as you meet the other criteria, site size, they have a building to process these, I don't know what they're called, so I don't want to use the wrong name, but it's a commercially grown crop that then gets processed, but it's not a traditional orange, tangerine, grapefruit, it's another type of.
Right, and I'm not sure if you're describing a nursery as opposed to a grove, which is
It wouldn't be a grove. It may be more under the nursery side.
Right, so nursery is, and these are plants that are grown to be sold, to be transferred off the site
or grown to be harvested.
Well,
and then the harvesting.
Yeah, that's where we would not say that's necessarily nursery. I mean, again, a grove that's producing is not the same as a nursery.
Right.
In terms of those trees are there, it's there for crop
grow
production.
and put somewhere else.
Right.
Sounds like a farm.
Right. More
Yes.
of a.
Correct. That would not be a nursery.
Okay. All right.
Any other questions?
Chairman.
Sir.
Thank you, Mr. Chairman. Stan, I understand why we're here. I think Spencer Simmons brought something that was a bit of a challenge. He purchased a piece of property, and he wanted to do something with it, and he didn't like what he was surrounded by. Is that more or less?
Yeah.
If that's the case, how many other instances do we have in that area? Because that area, as you've stated, is customarily landscaping, and yes, they do go part and parcel. The landscapers are growing, they're cutting, they're spraying, and they have to be involved with all elements of agricultural husbandry in order to survive and be a viable company. There is limited areas where they can do that, and this has been customarily the area. So my question is, how many other instances, complaints, conflict that we've had other than this one where he wants to build?
And I'll start and then let Roland correct me since he's got his finger on the pulse for code enforcement. So out of the 17 businesses, I would say there are probably 3 or 4 that we've had complaints on, including Caribbean. So, out of the 17, we've had 13 or 14, we've had no complaints. And what we've found, some of the elements that are common in that is, parking and building and so forth, they're not right along the roadway, or they're not right up against a neighbor's property line. They're screened, they're buffered. Now, they still have plenty of traffic that comes out, especially in the mornings. Employees come in the mornings, they all tend to leave in the mornings for landscape services. They come back usually staggered. So we've had problems on probably 3 or 4 in terms of complaints, I'd say.
Because I can't, and this has been cropped up more recently, and I just can't avoid thinking about the old adage, you move next to the airport and then you complain about the noise. I live directly underneath JFK Airport in Queens, New York, and they had something called the Concorde, the SST. That thing rattled your windows and knocked stuff off the walls. Nobody complained. They lived there. It came. That was it. Same thing with the 747 SP. You knew when they were going above your house. You could wave to the captain. You don't complain. And I have a challenge about the way this was brought about, because somebody wants to build something and somebody was building something and they kind of put the cart before the horse. They made the building, but they had no plants. There was no plants there. They said, I had a bad year. Okay. That's kind of soft. For that, we're going to change the composition, the approach in which people who move in an agricultural area can operate, and that's why we have agricultural areas. And I think that we're harming individuals that might be in this line of work, in this business, in the growing business, whether it's the cutting is related. To me, it is. To others, maybe they want to speak about it, but with the growing loss of habitat for such environment, and if we have that habitat, if we have the agricultural area, it's very difficult to want to limit it so we can't see anybody else come about. That may be a boom for the existing applicants or operators, because, hey, nobody else can have this. That's great. But then eventually, their children will not want that business. And then it'll be over. And the same thing with the American farmer. And I just have that uncomfortable feeling about limiting this because somebody wanted to build something and they didn't like what was built down the road. Well, don't buy that piece of property, go somewhere else. I don't want to live next to a Tractor Supply, so I didn't do that. I live in Sebastian. It's very residential, and that's the way it is. That's what we chose. You choose carefully. I don't think that a lot of things have changed. I think that people are changing, and they don't like what they see, and I was just uncomfortable about it. Just wanted to share that, Stan. Thank you. You said you had a tough one coming up.
Right.
Thank you. Any other comments?
Just to address Commissioner O'Brien's comment, so when I was growing up, my mom had a nursery business, a wholesale nursery, and she did mowing and landscaping, and we did some bush hogging and that type of thing, and it was typically for the customers that purchased plants from us. We went and landscaped their home, and then it was a maintenance issue. They were comfortable with us, they knew we knew the plants, we could change them out. And so we had a crew. It wasn't the large crew. It was usually me and another person. She didn't have a high payroll because she had kids, but we would go out and do that, especially over the summer. So I think that it is a legitimate thing. I think that also, like anything else, you can have bad actors. You can have people that take advantage. I don't necessarily believe that's what's happening in this situation per se. I tend to think more like Commissioner Flesher, that this is a situation that's very similar to people that move to Fellsmere and then get upset when it rains and they can't get their car down the dirt road. So, you know, when you're in an ag area, you have to expect, you know, your neighbor's cows to get out and trample your petunias from time to time. It just happens. But if there is some conflict that needs to be looked at, you know, I'm open to looking at that. I'm more interested in hearing from the people that came today, because I know there's some people that have been waiting. So I'll reserve the rest of my comments for after the input.
And I'll wait till after.
Okay, with that, I'll ask if there's anybody in the audience who'd like to speak on this issue. Come on up, name and address at the podium.
Yes, I'm Tim Campbell. I own a piece of property on 37th, 733 37th Avenue. I owned the property for 20 years. My dad and myself did ag exempt for a number of years till he passed away. I'd just like to thank Stan for his report and the county commissioners for seeing the importance of this issue, and Roland and the zoning board and all their work they have done. But I'm not here for myself. I'm here for the fourth generation of landowners. Most of them are old and retired and can't afford to move. They've had this property for generations. They want to live in their houses that they've been living in. They can't live their way of life anymore. They have a caravan of vehicles going up and down the road in the morning and the evening. They can't go out and get their mail in the morning or their newspaper. They can't leave their windows open and get fresh air. These people are our parents, our grandparents, our great-grandparents, and their way of life is getting ruined by companies like this that have no regard for the community they come in and destroy for personal gain. This company is a commercial service industry, and it should be on a commercial piece of property. What they have done is they have built a commercial building under the smoke and mirrors on the back door of our codes. And what they're doing is not right. And it's A1, you're supposed to process agriculture. It's not a service industry. And I believe that we're going in the wrong direction with this. And we're not like other counties. Indian River County is unique. And if we're going to compare ourselves to Palm Beach County or St. Lucie County, why don't we have big condos on the beach? We're ruining our infrastructure by letting this happen. And we need to, and I'm with Stan, and I'm getting off my speech now because I'm getting really fired up about this, about changing our codes. But we got a pesticide company right beside an organic guy. The organic guy's been there for 20 years. We got a mixing station right by the organic guy's organic stand. That's no consideration for our neighbors. Also, irrigation company there. Are we allowed to have a tree trimming company in there now? They're going to tree trim? Is that ag? I mean, where's this all end? I've lived there for 20 years, and all the neighbors get along. Nobody complains about nothing nobody else does. But when somebody comes in there and affects the whole neighborhood, and the people are too old to come and defend themselves, I feel that I need to take off work and come and at least talk to y'all people. It could be y'all's grandparents, your parents. What are they gonna do? They can't move. They don't have a bunch of money to pack up and move to North Carolina because they can't stay on the house that's paid for. They don't have no more income to build another house, to move to a residential neighborhood. They were born there. Most of their family was born there. Their parents were born there. Their kids were born there. And now all they want to do is reside in their home that they lived there for 4 generations. And all that's getting taken away from somebody's personal greed. And that's the way I look at it. And I think that's the way that the Indian River County and y'all, I know a couple of you people up here have spoke that direction, that we need to look at, and not let these companies just go into these A1 communities and disregard people that have lived there for 4 or 5 generations. I think that's wrong. I hope you will consider my speech.
Thank you for your comments.
All right, thank you.
Name and address for the record, please.
Evening, Amy Simmons, 7250 37th Street. I've completely changed what I come up to here to say in response to Commissioner Fletcher's comments. My husband was one, along with Tim Campbell, one that brought this to the Commission's attention with a PowerPoint showing the 20 to 25 vehicles, major trucks, F2 and 350s, trailers, all the caravan coming in and out of the street that we've owned our property on long before long Caribbean landscape came in. We've been there 5 years. It's our dream investment property. We ride our horses down that street. Everybody in that neighborhood, we're here on behalf of all of 37th Street homeowners. There's barrel racers, there's arenas, there's cattle, there's a lot of other mix. There's White Rabbit Acres Farm, which is not a pretty sight, but we love it. It's part of Vero. So trying to classify us as people that came in and bought something and don't like what we got is completely wrong. We didn't move next to the airport. We moved into an ag area on a dirt road so we could ride our horses, so we can enjoy what that area has to offer. We have a grove across the way. We have all kinds of a variety of things, not people coming in wanting to move the ag business. It's a commercial ag business. Those overhead pictures, they didn't lie. There was no comparison between what Caribbean is doing and all those other farms. Caribbean is 50% of that property is a commercial building, 8,000 square feet with a parking lot with a huge capacity for a high volume landscaping mowing business. They didn't bring in a tree farm. There's no plants out there. Code enforcement's allowing them to do it now. And all the county and code enforcement are doing now is designing a ordinance to allow this business to fit in so you don't have to deal with that issue. A site plan should be required on these businesses because we would have all known what was happening, not this just come in and take away all of the dreams we all have that are out there. We were all there first, like Tim saying, 4 generations. Nobody's tried to get around the system or shut the gate for anybody else. They're just bringing in a commercial business that belongs in Old Dixie or in a commercial area. I think we can look at the pictures. They say 1,000 words. From all the cars going in, from all these overheads, this business looks nothing like the other farms in this area. And like Tim just said, why do we want to look like Palm Beach County? Why don't we look north? What are they doing with their ag? You know, they're not necessarily doing this. So I just want to say you completely mischaracterized the purpose and reason why we're here. We are fighting for all the other homeowners, and we're fighting for a legacy in this county to maintain our ag for what it was intended for. Thank you for your time.
Thank you, ma'am. Anyone else care to speak on this issue? Come on up, please. Name and address for the record.
My name is Ken Hendricks. I live at 6220 First Street Southwest. I have had a similar situation. I'm not going to give you all the details because you've already heard plenty of deep details. My details aren't much different. But I think what Commissioner Fleischer characterized as the old concept of moving to the nuisance, you can't complain. But when the nuisance moves to you after you've resided on the same property for 25 years in my case, that's a totally different question. I don't think I would be supporting this ordinance at all, although I am now, but not for the same reasons that perhaps some other people would. I don't support it because it solves the problem, because it doesn't solve the problem. I support it because it's going to require a complete review, I believe, of this entire situation, and it's going to be open, and it's going to be, there's an invitation to anybody that has another explanation or another way of resolving this problem to come in, and that's what I intend to do. So I think you ought to pass this on this pending basis. And then let's go into this review procedure and see if we can come out with something that's pleasing to everybody, although that's probably not going to be completely possible. In doing this, I would like to read something, only because this might be the only time this is going to be read in this whole process, and it may be the only time it's been read for years by some of the people involved in this process, and present company excluded. But there's a section under the same section that we're here to discuss called the purpose and intent. 911.06. It says the agricultural, rural fringe development and RS1 single-family districts are established to implement the policies of the Indian River County Commission comprehensive plan for managing land that is not part of the designated urban service area of the county, as well as land within the urban service area, which warrants a very low density designation as provided by providing areas suitable for agricultural and silviculture. Anybody know what that is? It's forestry. When I saw that, I thought it was a tip-off not to get to miss the trees because of the forest, or the forest because of the trees. But it goes on to indicate that the purpose of this section is to have an open space, vegetative cover, natural systems, aquifer recharge areas, wildlife areas of scenic areas. These districts are also intended to provide opportunities for residential use at very low densities to promote housing opportunities in the county. These districts are further intended to permit activities which require non-urban locations and do not detrimentally impact lands devoted to rural and agricultural activities. Districts are intended to buffer active agriculture areas from urbanization. This is what the original designation of the A1 district was recommended to be and to look like. But if you look at the things that have been presented to you and described to you, it's completely different than what the original purpose of intent of this ordinance provides. I don't know where we got off track. I suspect it was years ago, but I'm looking at this opportunity to have review and analysis of this proposed ordinance as an opportunity to look at the origin of this ordinance to start out with, way back to however far it went, and try to get things back on schedule and back on the beam, because it has deviated from the original purpose and intent. Thank you.
Thank you. Anyone else from the public like to speak on this issue? She Chisel, we'll get to you right after her. Name and address to the record.
Sandy Hall, 7080 57th Street. We purchased our property over 20 years ago, and with the knowledge that we could have our off-site landscaping service. That's the reason why we purchased it. We've been in business for over 20 years out there. My only question, I think, is this is the permitted uses for A1, and under where it says nursery, greenhouses, and then when it says commercial, it says cultivation, comma, wholesaling, comma, off-site landscaping services allowed. It doesn't say anything about accessory, about it being an accessory. Now, we have a registered nursery on our property. We grow lots of plants and whatever. We're buffered and everything. Don't think we fall into any of the complaints. But I just want to let you know, I'm just a little confused with the word accessory, where that came in. I see they are trying to put it in the new ordinance type of thing, and that was my only question I wanted to throw at you all. Thank you.
Thank you. Sir, name and address for the record, please.
It's George Bartosh, 6420 37th Street. I'm the owner of Treasure Coast Turf and Trees, one of the properties that are noted. I see in the news you're trying to say we need 9 acres or more, and I'm 7 acres. And I have no off-site services. I'm strictly a nursery. I was visited last year by the code enforcement for selling retail. We stopped. At that point, there's no more retail. I'm trying to figure out how we're going to make, where I'm going to stand in this now with the acreage size, where that puts me. If you're going to reduce it to make it 9 acres, where do I stand in that?
Yeah.
I've been there 15 years.
Okay.
I am a wholesale nursery with no off-site services. None.
Okay, we'll let Mr. Bowen answer that question.
Yeah, two things. First of all, if you're only doing wholesale nursery and there's no landscaping services uses, then it wouldn't affect you at all. You're a 7-acre nursery. But if you had landscape services that was in existence now, you would be grandfathered in.
Well, we strictly deliver our products and grow our products on site. But when I saw the 51 to 49, I said, I know I have more than that proportion anyway. But where does this stand with me? My boundaries, my shade houses being on my property. I've screened everything. I want to make sure that this is a long-standing business.
No, I understand. And I think with any ordinance that passed that would be more restrictive or clarified from what's now, you would be grandfathered in.
Thank you.
Anyone else from the public wish to speak on this issue? Name and address to the record, please.
Hi, I'm Jody Valdi, and I live at 33 53rd Circle, but our business is at 6300 First Street Southwest, Tropical Property Management listed. There are a lot of concerns I have with the way the ordinance is proposed. These people are here complaining about their residential homes in an agricultural area. Again, it's designed to be agriculture and farming first, not residential. I feel residential is an accessory use in an agricultural area. As Mr. Fleischer said, you have moved by the airport, and why are you complaining? The surrounding counties have all, and it's been historically allowed, I believe, throughout Florida, that you can have a landscape services in ag. This is nothing new. This is nothing that has changed. And I feel that you're dramatically trying to limit the agricultural use of our properties. Again, it is a right to farm state. And it's not a beautiful deed-restricted residential area that they are trying to complain that they're being impeded on. And again, there's another issue that's written in there. They're asking for visual screening to any kind of expansion or change, and there's no definition to that. This is something we could spend $100,000 in attorney's fees arguing over what that means. Does it have to be immediate visual screening? Can it be grown up? Does it have to be on all sides, or just the side of the neighbor that's complaining? Like, where does this end? So you're saying now for parking areas have to be visually screened. Where does that go out into the future to all other farmers that aren't nursery, like commercial nursery farmers? Like, will all of their maintenance buildings have to be screened, and their irrigation pumps? There is no end to where this ends once you start limiting agricultural rights. And they didn't really define expansion or change of any kind. I mean, you're grandfathering in existing businesses, but we move one little brick and our neighbor, as my neighbor has appeared, wants to say, I've made a change because I've moved one little thing and now I'm subject to all of these new rules and regulations. This is unreasonable. And and then how do we come up with, all of a sudden we're in A1, but you're gonna deem it has to be a 4,000 square foot site instead of a 200,000 square foot site? How is that fair when it's being sold as Ag 1, 5 acres? Now again, I'm on 20 acres, but it limits my future use and value of my property. Another issue are the 50-foot setbacks are unreasonable. On our property of 20 acres, if you measure 50-foot setbacks around my perimeter, it's about 180,000 unusable square feet, almost 5 acres of unusable property. That is totally unreasonable. As I've said, this proposed ordinance will devalue our agricultural land as you have limited the use and increased the cost to utilize our agricultural property to make a living. And just 4 of the companies represented today here employ over 200 people in our county. So you are limiting businesses, small businesses that provide jobs here. And again, my last and major concern is there's no actual protection provided in the proposed ordinance for existing legally established businesses such as myself.
Thank you. Anyone else from the public wish to speak on this? Name and address to the record, please.
Hi, my name's Peter Robinson. I live at 315 Gray Twig Road, Vero Beach, Florida. I had a call yesterday from a guy who was a farmer and asked if I would come because he couldn't come. And his point to me, and the point I want to pass on to you, is I think you're going out and hitting a lot of people who don't know anything about this ordinance. I haven't seen it, advertised or, because you've got a lot of landscape people. You have a few of them here, but you had a bunch of them shown up there, and I don't think they were all notified. They just found out about it. And I don't, at one point, I did own a nursery years ago, and it was right in there with all the other farming and everything else. And I can remember when the debate was about whether we're going to allow housing in these agricultural areas because of just this fact that you're listening to today. And I can remember as a developer that when I had to develop, I had to put up a great big fence, and I had to create a special buffer zone on my property to protect the agriculture. So we did it. And then finally, we've got a problem with agriculture overall in this county right now because everything's changed. It used to be pretty simple. You put the fence up because you knew the guy was going to spray, and he'd come down and spray his groves, so you made darn sure when I came in and put the houses up against him that the spray wouldn't blow over on the houses, so they wouldn't call up and complain about the citrus. Well, now we don't have citrus. And we're going to have to come up with some other ideas and other long-term uses of a lot of this property in this county that, there's a lot of things that can go on. I noticed, in your backup material, it talked about the fact that there's energy resources allowed in agriculture. Well, I'm not sure that was there all the time. I think what really kicked it up now finally is FP&L and their solar plant out there. And that's a real plant, There's a lot of other type of uses like that could be put out in agriculture that isn't going to really bother anybody. And we've got to start setting up to start thinking about these type of ideas. If a Google came and wanted to put, 100,000 square foot computer plant out there that ran computers all day on 1,000 acres, probably wouldn't bother anybody, but it would be a hell of a job creator. And today, we can't really do that. You know, we have to, you know, but that's the change. In the old days, we didn't have to worry about it. We had citrus, and it went to Japan. We got a lot of money, and it was a great deal. But the days changed, and I would hope that, you know, this commission would think about setting up some long-term group to study what we're going to offer in our agricultural areas and get all the agricultural guys and everybody involved, because it's got to be a long-term thinking process. It can't be, let's just have a meeting after you guys are worn out and beaten up by your staff and everything, and vote for an ordinance that Stan thinks, hey, let's make it a pending ordinance. It'll be great. And then Stan says, goodbye, see you later. You guys get stuck with it. So,
What's
you know,
wrong with that?
you know. So, anyway, that's just my feeling about it, that you need to take a longer-term look at this. And there's going to be these problems, you know. They've been around. They were written in back when you develop an RS3. They were written in that we had to protect them. I came in and wanted to put my first development on Route 60. And Ralph Sexton was chairman of the Planning and Zoning. And he said, this is prime agricultural area, and it shall not be developed. Route 60 shall not be developed at all. We're going to protect the agriculture. And it was an interesting meeting because they wanted to draw a green line along Route 60, and they kept arguing over, that can be a 1/4-inch line or a 1/2-inch line. And we're sitting there saying, you might want to figure out how many feet that is, but we didn't say anything. We were the new guys in town. So, you know, this has been going on for years, and you've got to get ready for it, and things are changing. You know, those things that we argued about back then, heck, we had just regular old telephones. We didn't have cell phones. And I was talking to Stan, since he's leaving, the other day, and, you know, they used to have all these regulations about where you could have your office and what you could do with your office. And I said, Stan, my office is in my pocket. And I can sit here in this meeting, call somebody up and do some business. But, you know, in the old days, that was verboten. You couldn't do that. So I'm just saying we need a little longer-term thinking about this. Thank you.
Anyone else from the public wish to speak on this issue? Commissioners?
If I might say something. I agree that there's a lot more wrapped up in this issue than what it really appears that we're being asked to make a decision on. So if I can make a suggestion that we maybe step back a little bit and take a longer term approach to solving this problem, instead of shooting from the hip. We do have an Ag Advisory Committee. They are made up of representatives from the cattle industry, citrus, vegetable, irrigation, horticulture, and associated industries. That kind of covers the gamut of the majority of the ag interests and businesses, because my concern is there are legitimate ag uses, and I don't want to impact those uses while trying to cure a situation that may be an anomaly. But I do agree that we need to look at what's happening in our community. I mean, we deal with it with the roads. This is the next step of that. So I would be happy, as the current liaison to the Ag Advisory Committee, to take this to them, get some buy-in and some feedback from that group as far as what is going on, and then we can take it from there. I don't know if the next step would be planning and zoning, and then back to us. I would look to Stan and Roland to determine that, but that might be a good and reasonable way to try to address this without creating more problems while trying to fix one problem.
Second.
Is that a motion?
Sure.
The motion from Commissioner Adams, second by Commissioner Flesher. Any other discussion?
Yeah, just, you know, Commissioner Adams, I understand very much your relating to the family nursery and associated business you had back then. When I mow my grass, I don't think, man, I'm farming here, you know? And when I see the commercial lawn maintenance company come to my neighbors, I don't say, hey, look at those guys farming across there. You know, so I just don't see mowing the grass trimming and getting the blower out as agricultural activity.
Well-
Now, let me just say, my wife's 52 pineapple plants, I think I'm farming then, okay? Because I'm growing a product that produces an edible thing. That, to me, yeah, we're farming pineapples. But when I'm cutting the grass, to me, that's got nothing to do with ag at all. And so I'm having a hard time making the connection here. And I fully support what Mr. Robinson said. I think we do need to look at a lot of these ag uses and update it, given the status of citrus and things. And I'm glad you're willing to take the lead. But I'd almost rather go ahead and put in the pending ordinance, just so we don't get a bunch of late people coming in and taking advantage of the fact that we have a gap in our regulations.
So, two things let me address. One, I understand what you're saying, and let me rephrase what we were doing. We had a greenhouse, we had 5 acres of planted in-ground oak trees, we had a potting, all that stuff. So, yeah, I know, but I get what you're saying. In this situation, I do understand that those parts of this business are not there, and that's what's kind of creating some of this conflict, is there's that fine line, and how do we
And I think
impose
the
that?
scale, you all
And the
had, what,
scale.
one truck and one trailer?
Right.
And not 10 or 15?
Right. So, but again, if we're gonna make a regulation, we need to make sure that we're not scooping up the innocent parties in that. To the point of the pending ordinance, I would be fine if that was, we do a separate motion on that, or, and then we have the pending ordinance to protect whatever may be coming down the pipe, because it won't impact anybody that's currently in operation, correct, Stan?
Correct. And you can make that clear in in the next motion.
And then we can invoke that separately from kind of looking at this bigger picture of this in the ag area. Is that, or if you want me to make it in the same motion, I'm happy to, but I figured it probably, because I know there's some feelings here that maybe it needs to be separate.
And that's fine. We can go with what you've made so far, and then I'll make a motion on the pending ordinance.
And I think this is a great way to address this. And one thing, thinking of the courtesy of after going through, somebody explaining to me how they get their organic certification, if you've got a guy mixing pest control material right next to it, it's a courtesy issue, it's a fairness issue. You can't have 2 legal operators potentially, but one affecting the other. So hopefully that will come out to where there's a way to, we can't regulate everything, but then you got to get down to just common sense of how do you treat your neighbor. And but I think you're taking it to the ag folk. That committee will probably bring things to light that we hadn't thought of either.
I'm good with both of them. I think the gentleman who brought up the idea that we should pass the pending ordinance and allow the process to come up with a better solution, I think that's a good path to take. I think taking this to the Ag Committee is a good take. We've been focusing on whether it's residents are impacted, or whether what I would consider commercial businesses are impacted, but this is supposed to be an ag area. So how would agricultural people react to, or what would they think are appropriate uses, I think is an excellent question to be asked of the ag people. So I'm good with both of those paths going forward. Man, we generally don't like people to speak twice, but come on up if you're quick. And
Can you please explain to me what a pending ordinance means? I highly object to the verbiage of this pending ordinance, as it's totally not clearly defined. So if it's a pending ordinance, can you only approve that ordinance, or can it be altered? Because the terms visual screening and expansion and change are totally undefined in this ordinance. And as it stands now, it does not read that off-site landscaping is even attached to cultivation or wholesale nursery. And so you are totally changing things, which I feel is totally impeding on agricultural use in the state of Florida, which is limited by the state. And I do not understand what this pending ordinance, without it being reviewed, is going to do.
okay, so basically a pending ordinance says that, there's some issue out there. We're not positive how we're going to resolve the issue. We have one proposal, and we basically don't want things to get worse. So if somebody new were to come in, they would basically have to follow this ordinance with what they want. It doesn't say that this is what we're going to pass in the end. As a matter of fact, in this case, we're saying we don't know for sure what we're going to pass, but we don't want the problem to get worse in the meantime. So we're hoping that with the process that is set up in this motion, that we'll end up with, we may end up with no ordinance, but hopefully we'll end up with something better, especially for the ag community in that area, and something that most parties can live with. But my guess is that if an ordinance is passed, by the time it gets through the ag committee and the planning and zoning board and the board of county commissioners, it'll look significantly different than what's before us today.
Okay. Again, my major concern is visual screening. If you are in a residential area and you don't want to see your neighbor's property, visual screening is on you. It's not on your neighbor to take part in. So I'm not understanding this as part of the ordinance.
It won't impact anybody who has a business right now, but some people don't consider a massive landscaping business as an ag use. So it addresses their concerns. So, and some people, for me, I was a farmer, I wouldn't consider a massive ag landscaping business as an ag use. Some people who have farms put biosolids on their property. I don't consider that as an ag use either. But the ag community is changing, so maybe they feel different about those things. So that's why it's good to go before the ag committee. But again, if you have a business now, this isn't going to impact your business at all. It will prevent some new businesses perhaps from going in ag areas during the pending ordinance period.
Well, again, my concern is you're attaching it doesn't say that my existing legal business is in here. You're saying that it is, but you have addressed expansion or change, and what does that mean? Where is that
We will try
defined?
to,
If I need to change something in the meantime while this is a pending ordinance,
Well,
am I then subject to all of these rules?
So the concept of the pending ordinance doctrine is really for someone who's new coming in. And that's really what we're talking about here. You're operating right now. And so the concept is if someone comes in for this new thing, we're going to be looking for them and say, hey, look, I'm sorry, but you're going to have to comply with these regulations. It just doesn't open the door so that people realize this is about to happen. So we get, a flood of applications to try to do these things. So for your business that's already operating, there's no new requirements that are going to be imposed upon you as part of this process of adopting an ordinance, or if the board decides not to adopt an ordinance.
Okay, thank you.
But I think Stan said, and I know he's leaving, so he can say these things and leave.
Yeah.
But I think he said very clearly that if she wants to go out and she wants to start making changes on her property, and it doesn't meet this ordinance, then she's not going to be able to do it. And that's what I'm talking about. You're going to hit some people out there that don't know anything about this, and then you're going to knock them off one at a time, because that's how government likes to do it. They get the little guy in one at a time and whack, knock him out and take him out. And it's not right to do that to somebody.
Well, the other question is, was it right for them to put that type of business in an ag area? So it's both sides of the questions. And what we're trying to do is come up with a reasonable temporary solution so we can get what you said was a better long-term result.
Right, I know.
So yes, some people will be impacted during that period, but we can't do anything that's going to be constructive for the community without somebody being impacted to some degree. That's just life.
Right, but you're impacting them without giving them a chance to get in here and talk about it. And historically, you've had landscaping out there for years, and you're saying,
No,
goodbye.
No, we're not. We're just saying you're going to have to be cautious for a
If they want to
while.
expand, you're
Yes, if
whacking
you
them.
want to expand, that's correct.
You're whacking them. You're whacking them.
Sir.
Brian Stoltz, Caribbean Lawn and Landscaping at 7120 37th Street. I'm a lifelong resident of Indian River County. Been here since 1960. Grew up in McCanch Park. 2002, Villa Avenue, which was 27th Avenue back in the day. That was west of town. We're building for the future. As I know the gentleman mentioned greed or whatever. Everything's moving out west. When we came to, we're building for the next 20 years. It's not, and that takes a process. When I did my due diligence, when we started this whole project, we started 2 years ago before we bought the property and got permission to do everything that we were doing. And coming in and saying that we would be a good neighbor. Some of the pictures that have been displayed are old pictures. They're not recent pictures. We don't mix chemicals next to an organic, operation. We wouldn't do that. We have more respect than that. We help grade roads. We demand respect from our employees going up and down the road. Like I mentioned to Roland that this takes time. We have a $1 million investment where we have to put infrastructure in first, irrigation, the trees, and we didn't plant oak liners. We planted something that is a crop that produces every 3 years, every 3 to 4 years. But you have to start somewhere. And me in a business, I've actually have done this on the next street over for 17 years. Never heard of an issue at all. Have grew my business, for 17 years on 41st Street. Not a problem. Same nursery, same business. I actually ran it off of 20 acres outside of my house. Not a complain one. But we do help grade the roads, and we do make sure that our employees are driving a lot, slower in respect. And, it's not like we're racing up and down the road. And we do, like I said, we help the neighbors. We're good people, and we're just trying to provide for our family down the road, and my son who would like to go into the farming industry, down the road. So again, we went through the proper steps and got the permission to do what we were doing, or we never would have made this investment. But to say it's greed, it's not greed. It's the future.
Thank you.
Thank you.
Anybody else care to speak on this issue? And Commissioner, before we vote, I'm going to ask you to restate the issue, so
Sure.
you can be prepared.
Okay.
Todd Thompson, 7065 37th Street. I'm a third-generation farmer and developer here in Indian River County, and I'm also a general contractor. And I've spent the last 20 years of my business building more of the agricultural buildings. And just up until the last couple of years, the county had nothing in documentation for a non-residential structure in agriculture. So you could just about build any pole barn, anything you wanted to, totally exempt with the agricultural use classifications. Just until, like I said, a couple years ago, they implemented this non-residential application that I don't know exactly where it came from, and I checked into it a couple times in the last 2 buildings that I just built for somebody. One specifically off of 77th Street. We followed all the agricultural setbacks. We put in our landscape buffers just because the customer having the respect for their adjacent neighbor. When I went to the building department, I was told that I needed this. We're halfway through construction, and we wanted to get an electrical riser put in for temporary power. And I was told I needed this application. So that brought it to my attention, what about this monstrosity that was just built out here on 37th Street across from my house, where I've lived for 15 years, where my kids have grown up and down the road. And I've jumped Brian out a couple times about before he even moved, because I also had 40 acres and 20 acres on 41st Street across from his old place. About if he was going to move onto 37th Street, help out with the roads, just do a little grading. And we bumped heads right off the bat because I also own property there. What I'm getting to is the county allowed this to happen. This isn't the residents' fault. This is the county's situation. The county agreed to this application of non-residential farm building and offices application that Brian Stoltz sent in, and they stamped it in May of 2018 and said, okay, we'll allow Indian River Project Management to be your contractor to build this non-residential building, but you have to comply with what you stated under oath when you sent in. But never did he comply. He built a structure with everything and then some from agriculture. I grew up on 130th Avenue. We were beef farmers, ranchers. That was agriculture. When we mowed a grove or we mowed our farmland. We didn't mow a residential lawn and then come back to our agricultural building. So I stayed quiet. I stayed out of this for the longest period of time. But I don't like the smugness of what's going on here with the fact that the county needs to step up. They haven't once stepped out to maintenance our road more than they used to. It's still a washboard every time you turn around. I will give you, Brian's had his guys be very respectful in driving down slow when my kids are riding a horse or even passing me. And I think they kind of doing that because I'll stir up the pot. I'm not here to stir up the pot. I'm here to say the county needs to step up and do what they allowed to happen and take position. If they would have required a site plan for this application that now is a requirement, then they would have asked that Brian put this building on the back of the property or put in his proper landscape buffers, or better yet, comply with his affidavit that he sent in of what he was going to do, which in a nursery sense would mandate him to put in his nursery first before being allowed to build his building. So I'm not here for just the residents and or to bash Caribbean landscape. I'm here to say the county can step up for what they allowed to happen and come to a reasonable solution before it gets out of control. And implementing this into the guys that are coming in, I think that's a great idea. Slow it down a little bit. We know it's not permanent yet, unless your motion is to just deem it permanent. I think that, there's a lot here still needs to be heard. I think hearing from the Agricultural Board is a great idea. Listening to their thoughts with their criteria, it may help ease some of the anxiety that the people on the street are having, such as the chemical stuff and others. I think just that's where I think it should head. So,
Thank you.
Thank you.
And before I forget, anybody here who's interested in this issue ought to give Stan, and when Stan leaves the Community Development Department, their name and hopefully their email address. And I'll ask the Community Development Department start a list of people who are interested in this issue, so that when it does go before the Ag Committee, and then when it does go before the Planning and Zoning, you'll get timely notification, and we'll be able to attend or otherwise let people know how you feel there. But I think that all of us will come out a lot better on this if there's a lot of active discussion and if everybody from all sides of this issue are involved in the discussion. So with that, I'll ask if there's anybody else in the audience who wishes to speak on this issue. Stan, did you have a?
Just to clarify the motion, as I understand
We're going to
it,
ask Commissioner Adams to restate the motion before we vote.
just to, process-wise, does it include authorization to initiate the formal amendment process, which that's going to be the second? Okay. Right.
So the first motion is to take this issue before the Ag Advisory Committee for input, and then from there, they can make a recommendation to Planning and Zoning, and then Planning and Zoning can recommend back to the commission. So it's fully vetted on all levels.
Right, and so it'd be the formal process after the Ag Advisory Committee. It'd go public hearing in front of the P&Z, public hearing in front of the board, and we can contact interested parties all along the way.
And not just this issue, but
The issue
overall
of
ag use in
ag
other.
use as it conflicts with residential uses.
Yeah, it ought to be a wide-ranging discussion about what does ag land mean in Indian River County today.
We will have a holistic discussion on this issue.
So second.
So that's the motion.
And just for those, in every one of those steps along the way, there's public input opportunity. And to
Yes.
some,
I would just echo what the chair said as far as please leave your contact information, because I would like to make sure everybody here is aware when the Ag Committee's meeting and those types of things for input, because that's the point of this, is to have as much input from all sides as possible.
Okay, we have the motion by Commissioner Adams, second by Commissioner Flesher. Any other discussion or comments? All in favor?
Aye.
Any opposed? Motion passes 5-0. Commissioner O'Brien.
Mr. Chairman, I'd like to make a motion for staff recommendation, which is to direct staff to initiate the formal land development regulation amendment process and to invoke the pending ordinance doctrine for the proposed draft ordinance during the formal adoption process.
I'll be happy to second it. We have a motion by Commissioner O'Brien, second by Commissioner Solari. Any discussion on the issue? All in favor?
Aye.
Any opposed? Passes 4-1. Commissioner Flesher dissenting. Thank you very much for that. We now move on to G4, which is due diligence and project review, West Regional Wastewater Treatment Facility Reclaimed Water Storage Tetra Tech Amendment Number 1 to Work Order Number 2.
Mr. Chairman, I'm good to move this forward. I
I'll
can let
second it.
staff,
Any discussion? All in favor?
Aye.
Any opposed? Passes 5-0. Good job.
Great, Vinnie.
That was Solari.
That was O'Brien.
Brian
Solari.
Solari.
And then, Mr. Chairman, I can table my item that we had added.
We're not up to you yet. You wait your turn. County Attorney matter, Sunbreak Farms, Attorney Reingold.
Thank you very much. I'm just scanning my notes, just figuring out. Okay, basically,
Move staff
yeah,
recommendation.
May 24, 2019, South Florida Water Management District issued a notice of intent to deny an application for a modification to an environmental resource permit for Sunbreak Farms LLC. This is a piece of property mostly in St. Lucie County, partially in Indian River County. I can tell you yesterday, St. Lucie County filed a motion to intervene in support of the district's denial because in the interim period, Sunbreak Farms has challenged it, simply looking for direction from the board as to whether to file a motion to intervene.
So the issue is, shall we file a motion to intervene on the Sunbreak Farms lawsuit? Yep. Any thoughts?
Motion to intervene.
Second. Any discussion? Anybody from the audience care to discuss this? There's a motion by Commissioner O'Brien, second by Commissioner Solari. All in favor?
Aye.
Any opposed? Passes 5-0. Thank you.
Thank you very much.
Jason?
And if I could just add something, there's been an application in Brevard County. Staff may take some action on that, so I just want to make sure that we're.
So I think
okay
there's probably consensus that staff ought to follow that issue closely and advise if he sees anything and let anybody know that I think this board can.
And it sounded like Brevard County wanted to work with us as well. They were getting worried about it, so.
Sounds like they're concerned. It's upstream of one of their water plants, so.
So we'd be happy to have you come back and fill us in on that, and I think we'll probably be very supportive of most of the things that Brevard wanted to do. Commissioners?
And did we also reach out to Osceola to the west, just to make sure they don't have anything? Because some of the Blue Cypress Lake area does flow from Osceola through and into that watershed area, just to like to know what, if anything's going on in that area as well.
I don't think anything is really stopping them from doing anything right now, and from what Commissioner O'Brien has said about what FDEP indicates what they're planning on their rulemaking process, it probably doesn't get to where we need to go to get, so we're gonna have to watch this very closely. I think we're not anywhere near where we need to be with the biosolids issue yet. So with that, we've got a motion and a second. No, we've got, we already took the vote on yours? Yeah, good, we're done. You want to table yours?
I will table mine, but I will bring it back just so the board is aware of the issue. And I've already talked to staff about trying to get some communication out to the architects and surveyors and builders about the new process going on. So that's good, but I'll bring it back so you all understand the
Great,
issue.
we look forward to that. And with that,
Whoop, move approval of the solid waste minutes of April 16th.
we have a motion by Commissioner O'Brien, second by Commissioner Adams for the approval of the minutes of April 16th. All in favor?
Aye.
Aye. Any opposed? Passes 5-0. Change order number 4 to Thale bid. That was I'm going to give it a motion by Commissioner Adams, second by Commissioner Zork. Any discussion? All in favor? Aye. Any opposed? Passes 5-0. And with that, thank you, everybody.